Okay, are the group leaders present in the meeting? Hazel? Okay, okay. If they are present, just either ask them to drop one line of reminder in all the groups with the links, okay? Or you just share it in all the groups, all the 20. The link and this particular message, the message that you shared in the morning in the main group, that message. With the attendance criteria, everything. Okay, welcome everyone, the group leaders especially. The admin is going to post a reminder with all the details regarding your attendance criteria, everything in the groups right now. So all of you are also requested to get in touch with your group members and ask them to join as soon as possible because our panelist has already joined. So we request that you please join as soon as possible. Okay. So we had requested that everyone should join by 5:45 p.m. It's very surprising that people are too late. So please join as soon as possible. Thank you. We'll start sharp at 6 o'clock Indian time without waiting for anyone. And if you do not join by 6:10, then we'll put you as absent. Simple. Because MS Teams is already automatically monitoring your attendance. I'm very excited about today evening because we have a very, very eminent panelist starting the first session and followed by another eminent panelist. So I'm very, very excited about today's panels. I'm sure all of you are excited as well. So please follow up the messages in all the groups and request everyone to join immediately without any delay. And please keep yourself muted at all times. Do not talk, do not interact, do not put on your video on. Okay, everyone's videos and audio will be muted, will be disabled throughout. And do not post anything in the chat which is not professional, okay, because it's a professional platform. So you can give, you can say good evening to people, you can say hi to people, you can say where you are from, joining from, when you can also introduce your field of work, etc. You can do all that, but do not say anything unprofessional in the chat because it's all monitored and recorded. So please don't do it. Good evening, Parimala. Good evening, Batsiva Bade. Good evening, Sefo. Good evening, Mridul. Good evening, Danny Matthew John. Kaji Sarmat Kareem. Mustafizur from group number 3. Bibila Samuel. Tahira Tabassum Yusha. Okay, wonderful. Vishwajit Mandal. Amelia says good morning. Okay, we have a good evening in India right now and in Bangladesh. Dr. Surya Paraduli says good evening all. Samima Tahira is saying hello sir, good afternoon. eagerly waiting for the discussion to learn. Definitely, we are all very, very excited about it. Dr. Naurin Nusrat Nova is saying, good afternoon, sir. Greetings, everyone. So, greetings. Okay. Abdul Asadujaman is saying, good evening. Rajdeep Mitra saying, good evening. Dr. Divya saying, good evening. Avinash SD saying, good evening. Arita, good evening. Annuel from Group 8, good evening. Pavani Anand, Group 8, good evening. Okay, Humaira Hino saying good group lead from group 1, Najmoon Savda Humaira. Hi, good evening. Sharon, group number 25, Sharon. Okay, good evening. Good evening all. Mehul Kumar Dubey. Good afternoon, co-lead group number 11, Sikhani. Hi, welcome. Chandrima Das. Okay, so it's 6 o'clock. Still not, people have not joined. So please ask them to join fast so that once we reach 150 mark, then we'll start the interaction. Pritam Saha, good evening. Tajin Jahra Syed. Today people are a bit lazy because it's Sunday. Okay. Mayank Singh, good evening, sir. Group GP 49. Okay. Tajin Jara, good evening. Okay. Ismail Yamar, good evening from Ethiopia. Okay. Group 5. Sadeed Hossain, good evening, sir. Thank you for the opportunity. Nasib Mahmood, good evening, sir. Yes, welcome everyone. Please ask your friends to join as soon as possible because our eminent panelist from Malaysia has already joined. We have to start. It's already 6 o'clock. Please come fast. Please come fast. Please join soon. Emmanuel Dua from Seoul, Korea is joining us. He's saying good night. Okay. Uh, Namira Janat, good evening. Co-lead up group 12. Yes, welcome. Jusu Musa, greeting from Sierra Leone, and I am Jusu Musa. Okay, hi. Sohel Rana, good evening, sir. Okay, good evening, says Dr. M.K. Malati. M.K. Malati, Chennai, India. Okay, Ullah Muhammad Amanatullah, good evening. Okay, yeah, everyone is saying good evening, but let the 100 mark cross, then we'll start our meeting without any further delay because our eminent panelist has already joined. We should not waste any further time. Okay, let it cross 100 and I'll start without waiting for anyone because if nobody joins more after 6:10, then we'll simply mark them absent. We'll not give them any more time because we are very, very um, patient with people. Umera Hindu is saying good evening from Bangladesh. Yes, please say where you are from because we don't know everyone personally yet. I have seen some of you during meetings, group meetings, but I do not know everyone personally. And Dr. Vetri certainly doesn't know. It will be great if you can introduce yourself. Okay. So, good evening, everyone. I'm Professor Maheswar Satpathy. As you can see my photo on the uh, wall here, being shown on Spotlight. I'm the Program Director of Global Advanced Certification Program on Strategic Research Collaboration and Communication for Emerging Researchers. Faisal, can I ask, like, are we live now? Okay, and the link has been shared in the new group. Okay, thank you. Okay, so this is a 10 weeks long program. Okay, it's a very intensive, immersive learning experience that we have designed. And I will let the admin do the rituals, but I just wanted to take a bit of time so that you get to know that this is what the program is all about. Okay, because there are many new attendees joining on YouTube live right now and they are not aware of it. So this is the advanced certification program, but besides that, this is also having one component, which is the third component of the program called workshop series. Okay, and every week there will be workshop series happening for the next 10 weeks. So they'll be joining, eminent resource persons will be joining from all parts of the world, and admin will be telling you more details about the whole program. Okay, thank you. I pass the mic to Mr. Faisal to do the tunes. Thank you. Okay, thank you. Thank you, Faisal, for such a generous introduction. And so can you please make it ensure that you spotlight both of us, me and Professor Vetri first? Can you remove yourself so that I'm seen on the screen? Yeah. Okay. Thank you. Okay. So good evening. Welcome, Dr. Vetri. It's so wonderful to see you, and it's a pleasure to welcome you to our advanced certification program. Okay, so people are a bit lazy because today is Sunday, so they're taking a bit of time to join. Hopefully, more people will join in the meantime while we continue the session. They are slowly rising, and I can see that. So I have the absolute pleasure of introducing Professor Vetri. So Professor Vetri's camera and audio be enabled so that he is visible properly, and we do our dues. So it is my absolute pleasure to introduce and welcome Professor Vetri Selvan Subramanian, PhD. He is currently working as a professor of pharmacology at the Department of Medical Sciences, Sunway University, Malaysia. He graduated from Annamalai University, India, and began his academic journey in 2008 at Rajiv Gandhi University of Health Sciences, Bangalore. Over his career, he has accumulated more than 15 years of teaching and research experience at prestigious institutions such as Arba Minch University in Ethiopia, Mahsa University in Malaysia, among others. A prolific researcher, Professor Vetri Selvan has authored over 250 papers with a cumulative impact factor exceeding 700. He has filed 8 patents internationally and contributed to 6 books chapters. His expertise is widely recognized, as evidenced by numerous grants, including an FRGS grant from Malaysia's Ministry of Higher Education. Professor Vetriselvan Subramaniam, PhD, FMSA, he is also Deputy Dean of Internalization, and he is a professor of pharmacology, Department of Medical and Life Sciences. So he is primarily responsible for the international activities and enterprises that is undertaken by the prestigious Sunway University. Professor Vetriselvan has held prominent academic leadership roles, including serving as acting dean, deputy dean at Maheswar University, and held visiting and adjunct professorships at institutions in China, Cambodia, and India. His supervisory work is extensive, with 28 completed student research projects and ongoing PhD supervision at multiple international universities. He is an active member of several professional organizations, including the British Pharmacological Society, it's a very prestigious organization, the Indian Pharmacological Society, the Obesity Society, and the Malaysian Scientific Association. His research focuses on advancing drug development and pharmacology, and he has delivered keynote addresses at over 25 conferences worldwide. Recently, he was in India in the month of March to talk about some of the international collaboration with Indian partners, Indian institutions, with Indian higher education institutions. He is known worldwide as a leader in the area of biomedical sciences. I was very, very impressed with his profile. I know him for years. It's my absolute pleasure to welcome him as a guest of honor and as the keynote panelist to our advanced certificate program. He is a resource person to teach all of you. Okay, so it is your privilege to be hearing from such an eminent erudite person. So please make the best use of this opportunity. Please, if you haven't joined yet, please drop a message of reminder personally to your friends so that they join as soon as possible without wasting this beautiful opportunity, because you won't get this opportunity again in the future. Okay, you will learn a lot about biomedical sciences and what to do about it and what you can do about it, and maybe get a bit of success mantra from him. So I now open the floor and I request Professor Vetri Selvan Subramanian to kindly do the duties of presenting his work. So the format is very simple. He will initially begin with a short talk about his work, okay? So which we would have the pleasure of listening. After he completes his talk, we'll have a moderated panel discussion, and then we'll have about 5 to 7 minutes of audience question and answer. Okay, so I hope that is clear to all of you. So please make the best use of this opportunity and enjoy. Thank you. Professor Subramanian, please.
Thank you, Prof. Maheswar. Thank you for your nice and wonderful introduction on my background and my experience. I'm very happy to attend this international conference, virtual conference. So good evening to ladies and gentlemen, those who are attending here. So today I'm going to have a short presentation how the global research, especially the collaborative research work, how important among young researchers, not only young researchers, in also the academicians, how important to build up our research community and enhancement to engage with the partners, also to enriching our research community and to develop the next level or to move forward. Okay, with this, so,
have you enabled his sharing option so that he can share his presentation? Yes.
Okay,
good.
So this is the topic today. So I'm going to have a short discussion towards impactful and effective collaboration in medical research. Why is important of collaborations, particularly
Dr.
among hello.
Dr. Vetri, could you please put it on full screen mode? If you don't mind, yeah. You can do it from the below, the slideshow mode. Down below, bottom right, yeah, that one, yeah. No, it's going, the cursor is going away. This is the part that I always stumble upon.
It's okay. Can you see?
It is probably happening, not yet. Yeah, now it's fine. Great, thank you. Thank you, Doctor. Okay. Please continue.
So the topic is towards impactful and effective collaboration in medical research. Why is medical research is important? To translate into the clinical practice and clinical applications, which is very important, is kind of a translational approach. So from the basic research to bedside research, why is important? How to connect among the researchers, including students and those who are working in the industries and universities. I am Vetri Selvan Subramanian, working as Deputy Dean of Internationalizations, Sunway University, Malaysia. This is our university located in Kuala Lumpur. It's a center of the city. Is a top one. It's a private university. It's ranked in QS and Times Higher Educations. Also, we have associated with the University of Cambridge, Oxford, and several other universities. So I am going to discuss on global issues, particularly obesity. Why I am taking on the topic of obesity. So obesity is one of the major concern and threaten among Asian populations, particularly India, Malaysia. Malaysia is the #1 prevalence of obesity. Obesity is not only increase the body weight or to develop the the surface increase of our surface, our body weight or something looks like not only the weight increase, but also associated with the cardiovascular diseases, insulin resistance, also to develop the several cancers, including the cervix cancers, prostate cancer. There are many data. Recent days is many of them they diagnosed with the obesity induced several cancers. Obesity is a rising public health concern globally, especially in low and middle income countries. Asia is, despite its diverse socio-economic context, is witnessing a surge in obesity rates. So obesity is in Malaysia is a high prevalence. Also in India is very high due to lifestyle modifications, particularly the sedentary lifestyles. So there are many factors. Also genetic linkages also involved, but is very least. This presentation mainly explores how this kind of research is very important. Also how to collaborate with among the researchers to address the obesity through the biomedical research in Asia. So biomedical research in the context of the basic research to clinical applications. So Asia is over 60% of global populations. Is in the globally, is Asia is the highest populations among the whole world. Obesity rates have nearly doubled in many Asian countries over the past 2 decades. So recent 10 years or 15 years is a highly increasing the prevalence of obesity, particularly the low and middle income countries. There are several factors involved. Is urbanization, sedentary lifestyles, and dietary shift are a major contribution factors. Also, rising childhood and adolescents obesity is a key concern to increase the obesity among Asian populations. So also in Malaysia is a high prevalence. According to the Malaysian morbidity survey, they declared 2023, 2024. Also, they declared is obesity is a high prevalence, also associated with many diseases. So country-wise, the data from WHO is Malaysia is about 19.7% of adult obesity is they statistically they analyzed, so the high chance to develop the obesity among the adults. Also childhood is a 12.7, particularly in India is highly increasing. Is a 5% of adult obesity. Also particularly in the urban area, it's a 14.4 due to the lifestyle modifications. Likewise, several countries have particularly among Asian populations is a highly increasing of obesity due to there are many factors are involved. So how the biomedical research address the concern of obesity, or not only for obesity or any other diseases? So which is very important. The biomedical research is particularly we focus on basic research. The basic research will give ideas to get the solid evidence. Based on the evidence only, we move on to the clinical research. So the biomedical research is which is give lot of ideas to explore clinical research. So limited. So when we proceed with the biomedical research, we need to have a fundings, so research fundings. So one of the drawback is the funding is maybe sometimes very difficult to get from the funding bodies. Also the fragmented national data system. So the healthcare policy from the ministry, from the government also is one of the factors. So these are very important, how we go for effective research. Also the low translation of findings into policy or interventions. So how our policy making is a better healthcare providers, or how our guidelines we improve the healthcare system. So also concern need for capacity building among early career researchers. So the early career researchers, they should get a lot of opportunities. The opportunities how comes from, we cannot depend from only from the university or only from the government. Also, we are looking for the external organizations or external research groups, which is like global consortium, like Bangladesh, the global health research network. So these kind of organizations will give a platform to initiate or to proceed any advanced research through the biomedical platform. Biomedical research is mainly giving for ideas. So when we had a lot of discussions with different partners of our research members, also they do the same strategy, how we achieve the effective research or the solid evidence-based research initiatives. So which is very important. So when we proceed with biomedical research, we are looking for fundings, we are looking for good collaborators, good organizations which is give ideas and to connect with the people. So these are the factors to give better research outcomes. Also the importance of collaborations. So why we need to have a collaborations? So collaborations nowadays, which is mandatory, we cannot avoid. So multi-sectorial collaboration, which is very important, not only within the academic field, also we are looking for government, also the healthcare network. So when we have multiple collaborations, we can get a lot of ideas, the support, funding support. Also, we can carry out our research without delaying of our task. So when we collaborate with the many research groups, particularly the outcomes is a better outcomes. Also, South collaborations, shared context and resources challenges. So what we do is based on the regions, or based on the countries, or based on the among uh, the regional problems or country problems, we always finding the problem statement. So what are the problems currently? Based on the problem statement, we go for the context of the research and research findings. Global North-South partnerships also access the technology and trainings. Also, collaboration enhances data sharing, sample diversity, and intervention relevance. So these are the techniques. Why the importance of collaborations? We have to go for mixed collaborators with the public partners or healthcare providers and academia. Academia is especially among the universities and colleges and educational partners. So strategy, what is the strategy to address the emerging problems? So currently we have to align with the national health priorities. Let's say example of Malaysia. Malaysia have a high prevalence of obesity. So we should go with what is the high prevalence in the among the community. So when the people get is developing is obesity is not a acute disease, it's a chronic disease. It will take time to develop the obese condition. So during the obesity or after obesity, what are the risks? Mainly among the populations, there are many risks, cardiovascular risk, and insulin resistance. So due to insulin resistance, the diabetic also increase. Also the cancer development and neurodegenerative developments, including Parkinson, Alzheimer's, high prevalence due to obese conditions. So likewise, we need to align with the national health priorities. Also the leverage, the digital tools, we are using different digital tools to enhance our research activities. So foster our research activities, also to minimize or control our timing is to move on faster way, or to move on our research in effective way. So then nowadays is a tools, artificial intelligence is a very important to avoid the too much time or delay of our research activities, particularly among the any kind of statistical analysis. Also we are using for literature search. Sometimes we are searching for the data analysis. Also we are using artificial intelligence, but we cannot always dependent on artificial intelligence to find out the real solutions. Engage in community-based participatory research. Engagement is very important. Whatever we do, any research should helpful for community, particularly translating to the public benefits. Is a build-up. It's a regional health network. Is a Asian ASEAN is a non-communicable disease research collaborations also with other partners. Also, we are seeking of a capacity development grants. Without research grants, we cannot initiate any research activities. So the research grant is very important. In nowadays, is among the world, there are many research grant organizations. They're helping throughout the world. Also, TDR is a tropical disease research centers, NIH. So there are different types of funding bodies. They're helping for the research activities. Case study example, there are different types of case studies. It depends on the context and depends on the research areas. Let's say example is a community focused intervention among low income women. So particularly this kind of studies, we need to have multiple research team, including we are looking for how the low income people among the populations, what are the drawbacks, particularly the nutrition imbalance, also the behavioral sciences and public health. So there are different group of people involved, not only for biomedical scientists, also medical doctors, clinical pharmacists, nurses, and technicians, and laboratory scientists. So there are many group of people there involved this kind of research activities. Significant weight loss and improved is knowledge and post interventions. Also is unhealthy lifestyle, also it may chance to develop the obesity, not only for it's a kind of nutritional is a unhealthy lifestyle, and nutritional is a not is a appropriate diet, also it may increase the body weight. It's a particularly the obesity studies. Also, the funded by is MOH, Minister of Health, and supported by academic partners. So always the context of national priorities and the national health policy, they always encouraging to move on many research studies, especially in India. So we have collaborated with IIT Bombay, Indian Institute of Technology. So they always they align with the health priorities and national health policies. Particularly nowadays in India, is a chronic kidney failure is one of the is a major concern due to is a chronic diabetic, is a lifestyle modifications. Also, there are many factors are involved. Particularly the diabetic associated chronic kidney failure is a major concern among Indian populations, particularly those people with more than 10 years of diabetic mellitus. So there are many initiative. Every country's taking of is an initiative to move on further research or intensive research. The policy implications and research translations, which is very important. Use evidence-based policies like food labeling is how much the compositions of food, or what type of food consuming among the populations, or what are the ingredients, how the ingredients it may affect the health to increase nutritional imbalances. So there are many factors we need to identify. So translate finding into the locally tailored intervention. So when we finding of the gaps, then we move on to the particular or is a precision interventions with the particular disease conditions and research work. And also publish in open access platforms for the broader research. So when we identify the exact problems with among the populations, then we invite the young researchers, particularly early career researchers, or industry partners or academic partners, including the public health partners. We should invite them to have a collaborations. We should have a healthy discussions to move on to the further research to prevent the health issues. So why needed for the collaboration, which is very important, it's a must. Nowadays, we cannot avoid the collaborative research, or without collaborations, we cannot move on to is a further health solutions. So rising a disease burden and resources optimizations, contextualized solutions, capacity buildings. These four is very important to identify novel outcomes. Without these, we cannot identify the new inventions or new implementations to the public. So with this, the conclusion is the obesity in Asia is a multifaceted challenges and demanding collaborative research solutions. It means that must have a collaboration, then only we can get a lot of ideas to develop the newer drugs. Nowadays, currently, is a very limited drugs. It's a very few drugs only. Specifically, we are targeting of obesity. So when we have a biomedical scientists with the clinicians, we can get a lot of ideas to move on to further new drug developments. Emerging researchers in low middle income countries must adopt innovations and inclusive and interdisciplinary approaches. They cannot only collaborate with among their community or among their professionals. Also, they must have a multidisciplinary collaborative research work, including public health researchers, biomedical scientists, or clinicians, or lab technicians. So everyone is very important to have a potential research activities. Investing in partnership can bridge the research to policy gap and enhance public health outcomes. So the investment is very important. Grant opportunity is very important. So when the public health policy or the global grant scheme, when they implement the ultimately the aim is to go for public benefits. So we are looking for is a good is public health partners and the grant agencies, which is really is helpful to enriching the research activities. And collaboration is no longer optional. Is before we used to say is one of the option to carry out effective research, but it's a mandatory for the sustainable impact. So when we have is a good collaborations, then only we can sustain our research activities to get the better outcomes. The finally will go to the public health benefits. So with this, thank you everyone for listening my short presentations. Thank you for the organizers to give this fantastic opportunity to share my research thoughts to our researchers and research community. Thank you.
Thank you, Dr. Vetri. Wonderful. Hazel, would you please put both me and Dr. Vetri on the spotlight in one frame? No, I am showing on the top. The way it was showing before, like two people on one
online
screen.
session. T-shirts.
Please, everyone.
Sir, you are already both are in the one slide.
Is it? Okay, because I can.
Yes, sir. We are seeing that you are both in side by side.
Side by side in one frame. Huh?
Yes, on frame.
Okay, one frame. Okay, because it is showing for me as like separately. I don't know why. Maybe some sort of issue. Anyways, okay. So thank you, Dr. Vetri. It was wonderful to listen to such a brilliant, illuminating talk. Now we go towards the moderated panel discussion. Because I think the questions that I was about to ask you have already answered, covered some of it. But still, I will do the panel discussion because that is something which we have planned, and we are going to have a lot of very, very interesting questions. So I hope our participants who are present here right now, I can see 156 participants attending live here on MS Teams alone, and many people are. I don't know, some issue they are facing, so they are all attending on YouTube. I don't know because this is also, I'm also new to MS Teams, so I really don't know what issues they are experiencing. So anyways, so let's start our panel. Okay, so I think the talk you gave was very, very interesting and very insightful. So since you are a biomedical research scientist who has earned so much fame and international recognition. So the first question that I would like to ask you is, why do you think collaboration is critical in biomedical research, especially in resource-limited context? Like because this particular advanced certificate program we are running is primarily meant for all these emerging researchers, young emerging researchers from low middle income countries who do not have a lot of support and capacity building done already. So we are trying to provide a platform so that our young researchers can get supported, can get mentorship, the critical mentorship that they need, and they also get to learn about learning about effective and strategic collaboration by engaging in an immersive learning experience. Okay, that's the process. So this is the first question. Like, why do you think collaboration is critical in biomedical research, especially in a resource-limited context?
Yeah, Prof. Maheswar which is very important. Critically is important because among low middle income countries, they never get as a proper platform to carry out better research. Sometimes they looking for as a grant opportunities. Maybe these collaborations will give a lot of ideas to find out the appropriate funding facilities to move on advanced research with the collaborative, collaborating with the host and the exported. Maybe the collaborations makes them to go for better advancement research. Within their level, if they perform any kind of research, it may get limited. But when they collaborate with others, really those who are experienced, those who are really doing very well, definitely is a better opportunity to show their the outcomes. Through this, they can go for clinical applications. With the clinical applications, final outcome is to give some suggestions to the government and public health to make the public health policies to go for public benefits. So ultimately, whatever we do, any type of research, the ultimate aim is finally will reach to public benefits. Definitely. Even the lab research or either is a clinical research, our aim is to finally reach to public. So this is the aims we always encourage to move collaborative research work. But collaborative research work also will give a lot of ideas. Sometimes all the researchers may not know everything. Sometimes the other researchers will give a lot of insightful ideas to go for advanced research. So these are very important to why we need to have a collaborations.
Definitely, Dr. Patrick. Wonderful insights, in fact. I'm sure our young learners here, young participants, so we have many senior participants also in our cohort. They're enjoying all the insightful things that you have to offer here. I'm sure they will benefit from the experience and wisdom that you are here sharing with them. So before I move ahead, let me just announce one thing. Please, Faisal and BIHR team, please make it ensure that no one is speaking during the speaker speaks. Okay, please mute everyone. No one should be able to unmute themselves. No one should be able to turn on their camera. Am I clear? Hazel, are you able to listen to me? Yeah. Okay. Yeah. Please mute everyone, because there were some people talking during Dr. Betty's talk. This is not polite. Okay. Next. Okay, so the next question that I have for you is the 21st century is often dubbed as the century of biomedical sciences, right? The previous century, the 1990s to 2015, was called as century of public health. Now it is like the time for biomedical sciences to take over. So if biomedical research has to take priority in the upcoming years and decades, what are the key points to be considered by young researchers?
Okay. Biomedical research is not only biomedical research. Always the lab research is very important. Lab research means that is not only for within the laboratories. Whatever research is translating to the medical related developments. So we used to call biomedical research. So the biomedical research always translating to the public health. Public health standalone cannot perform any type of research. The public health research, based on the biomedical research evidence only, they move on to public health research. Public health research also, they can find out the health issues and among the populations what are the risk factors. But even though that kind of information is very helpful for the researchers, particularly the biomedical scientists, to initiate or to start up new type of research work to address the current problems. But everything is interlinked. We cannot separate. We cannot alone do for any type of research work. Definitely, we need to have all kind of research partners, multi-disciplinary scientists, including public health specialists, clinicians, and basic scientists. Without these collaborations, cannot do any type of research. Of course, public health, they can give a lot of ideas. Public health research will give the statistical analysis and the prevalence of disease conditions. Based on that, we can move on to further advanced level of studies, with the biomedical research. Biomedical research, mainly we are finding of therapeutic interventions and the therapeutic approach. So how are we going to improve the patient treatment outcomes? and how are we going to give the better treatment outcomes for the patients, or quality of life, how are we going to give quality of life for the among the disease population. So this is the best part we are doing as a biomedical scientist. But of course, we will get a lot of ideas and sharing knowledge from different areas, including public health.
So should they be mindful of something to keep them being active and let's say excel in their field in biomedical sciences?
Yeah, of course, is a biomedical is the pathway is a very important. This pathway is will give a lot of the new ideas to move on to the clinical oriented research. Particularly, the biomedical research only will give idea to move on to the clinical trials. Is a phase 1 study to phase 4 studies. The phase 1 study is a basically everyone knows, like small group of populations, healthy individuals, followed by phase 2 is about 300 individuals. We are part of this study. So then move on to the phase 3 is a large group of populations, different regions. This is the large group of. Finally, we move on to the post-marketing survey analysis. So there are different stages. But before going to the clinical trials, biomedical research also will give a lot of research evidence. We cannot go within a day. Let's say, example, if we move on to any new drug developments, it will take 10 to 15 years, minimum 10 to 15 years. It's not within a day, it's not within a year. It will take a lot of times to move on to the next level. It's the last 50 years, we never developed newer antibiotics. It's a many drugs is only for the new generations only coming, but very limited newer drugs only we developed the last 50 years. The reason is, one is for the research funding. Is a cost is very high. Also, there are other factors. Is the main reason is the cost effective. So this is the one of the major factors why is the newer drugs is not many newer drugs are coming to the market. But of course, many generations are coming out. Many generations coming out from the existing drugs. So this is the more advantage. Is a generation wise also we can improve the drug efficacy, also reduce the side effects. So these all studies is under biomedical research. We used to call biomedical research initiatives.
Right. Great. Thank you. So picking on what you just said, that as a biomedical researcher, conducting expensive lab experiments is one of the biggest challenges, and it is more so in LMICs, lower middle income countries. So as said by many of our participants, we had a particular exercise in which we tried to map out their challenges, their expectation, and many people said about their experiences conducting different kinds of research. And one of the constraints they said is expensive lab experiments, expensive research projects. And so if you are such an eminent scientist, biomedical scientist, so can you please tell us, how can we address this issue by strategic collaboration? What are the key steps to be taken in forming a strategic collaboration so that we can probably co-share resources, or so that our expenses can be reduced? What are the strategies that you have used which you think is very useful?
Well, Prof. Maheswar, actually is every country they're spending a lot of money on research. Is including Bangladesh, or even though in India, is even though the low and middle income countries, every countries they have policy, certain money they're spending on research. But the thing is the populations, also number of researchers, number of students. Especially the higher education level, like masters and PhD levels, the researchers, there are a lot of researchers, they cannot fund everyone. It's impossible. Sometimes they have to go for external fundings. They cannot only depends on the government funds, because a lot of students, not only the students, even though the professors also needed for research fundings. So the problem is the problem start from is the populations. Is among the populations the demand is very high, but countries wise every country they have policy on research developments. But the thing is, maybe among Asian populations, they may not get surplus funds because of the high demand. So with these conditions, how they can perform their research effectively, better they must go for collaborations. Those who are really doing well with the neighbor countries or with the industries. Industry also looking for good partners from the universities. So when some companies also sponsoring research projects, not only for the government agencies, also the other the external public health agency also they're sponsoring a lot of research fundings. So they have to find out the research funding agencies which is really helpful for them to go for the advanced research studies. So this one sometimes they may not know, they do not know how to approach or how to link with them. So maybe this kind of platform is very useful. They can get a lot of ideas. They get some connections with the international researchers, how to get the research collaborations, how we move on to the next level. So most of the researchers, including our lab also, we are doing, sometimes we are always doing with the existing research, like same type of research activities many years. But we never move on to molecular level, or sometimes we never move on to advanced, very advanced level. So this kind of research collaborations is very useful. So to get more advanced level. So my suggestion is better they should have a proper collaborations with the appropriate research scientist, not for everyone. So wherever they are working, better to have a good collaborations. Also, they have to hard work. They have to prove themselves. Okay, this is the concrete idea I am having. So with this, I wanted to collaborate with you to move on further research. So definitely, is everyone is accept. Most of the researchers internationally, they are looking for talents, the research talent. So really, if they have a talent, definitely they can get a chance to get the good collaborations to move forward. This is just my suggestions.
Sure.
So they have to find out the proper or appropriate person to have a collaborations.
So a key resource person or a key contact person plays a vital role in your opinion.
That's true. That's true.
Great. Definitely. Identifying the right kind of collaborator is one of the greatest challenges as well as a skill that we have to master as we grow and steer our careers, as we grow older also. That's definitely one of the challenges, but also an opportunity. It gives us such opportunities, right?
Nowadays, Prof. Maheswar, a lot of opportunities. Social media platform is very, is a surplus. It means they have a lot of opportunities to find out the researchers. 20 years ago, they may not get it, but nowadays everything is available. Everything their handphone, so easy to get a lot of opportunities.
Yeah, definitely. I think all that we have to do as young researchers, I would say that they must use all the opportunities that is available to them at their disposal completely for free. Many times, many things are completely for free. They're just available. They just have to put in a little bit of effort. They have to go to the social media, LinkedIn, such ResearchGate, academia, and just start talking to people. Once they start talking to people, so they will be able to identify who the right kind of people are as per their research interest in their fields of research, and probably that will set the tone and they will be able to, carry it forward. Okay, yeah. So going forward, I have many questions for you, so I'll not leave you without getting answered. So as Deputy Dean, internalization of Sunway University, what potential advantages and opportunities do you identify for international collaboration in biomedical space?
Okay. As an international deputy dean, my portfolio is to connect the people, like from the international agencies or international universities and the research centers. Many of them, they're looking for talent also sometimes. I am the role is a judge bridging from them to the researchers. If anybody approach, we have collaborated with many international universities, including Harvard University, Oxford Universities, and Arizona State University. There are several universities. Also, we have a lot of is a collaborative research projects, more than 25 countries. Not only this, also we have biomedical research centers with the different partners universities. So what I want to say is as internationalization's a deputy dean. So I bridging with the researchers to our university researchers, not only for academicians, also to the PhD scholars and MSc students, so those who are really needed for certain research, opportunities, and to carry their research work. We always just, my role is just bridging them, to connect with them, to get the proper to get the proper guidance, to get the proper platform to carry out the research. So very simple work. Mine is very simple, to connect the people. That's all.
Definitely, we are all here connecting people. For example, this platform that we have created with Global Consortium for Global Health Actors, Leaders, and Thinkers, and Bangladesh Institute of Innovative Health Research is purely a building bridge program to create a platform so that people across different disciplines, people across different walks of life, and people from more than 100 countries who are participants in this program are attending. Some of them are watching the live program, some of them will be watching later because they are asynchronous, they are based in different time zones again. So you have to be patient. I think we are all trying that. So let's do it more and more, and let's do it more effectively. So going forward to the next question, how can LMIC-based researchers, lower in middle income country-based researchers, successfully secure international collaboration, funding support, and recognition?
Low middle income countries, researchers, there are many talents from low middle income countries. So they have to find out what they have to fix, or they have to find out what their potential. Let's say example, if one researcher, if they wanted to collaborate with others, they must know what their potential. So which area they're working. Maybe in the public health also, more than 100 areas are there. They cannot go with everything. First, they need to find out. So which area they're going to focus. Okay, let's say among the disease populations, like they wanted to go for ovarian cancer, or maybe they wanted to go for as a prostate cancer, or they wanted to go for lung cancer, or maybe they wanted to go for obesity. So likewise, they have to fix their research work, or maybe they have to narrow down the target research. Maybe from the target research they can associate with the other associated disease conditions, fine, but they have to fix the area of research. So once they fix the area of research, then they have to search, they have to go for search to connect the people. So who all they're doing real research on obesity or diabetic mellitus, particularly the children's obesity. So likewise, if they find out, then they can communicate with them. They have to show these are the research work so far I have done at my lab. Maybe this is my interest area. So these are the future plan I'm having. Maybe they can share with them. So if I collaborate with you, this is my future plan, 3 years plan, 5 years plan. So once I collaborate with you, these are the plans. Maybe we can go for obtaining of research fundings, or one side, the simultaneously we can go for publications, research publications. Simultaneously, we can go for some engagements or public health research engagements. So likewise, they should have a proper plan. So if they have a proper plan, no one is denying. They can get easily. So they can get as a connection with the top researchers.
Definitely. And they can maybe get a good kind of funding and support, resources, and recognition in the due process. Right, definitely. I agree with that. So I think all that we have to do is we have to be industrious and resourceful, and without that we cannot be good collaborators, right? So going forward to the next question, I have a few more questions, so please bear with me. What are the common challenges in building equitable research partnerships? and how can they be overcome? Because I hope you recognize that people who are based in big countries, the Western countries, they operate with a bit of attitude, and those who are based in LMICs, they are always at the receiving end. So they have to always behave in a way as if they are little subordinate to them.
Okay.
So
Okay.
how do we create equitable research partnerships between different countries and different collaborators?
Yeah. Actually, is every level have problems. Every level have sometimes they cannot go smoothly. Sometimes they have to face some problems. Sometimes they may not carry out their research peacefully. Not only for low middle income countries, even though Western countries or anywhere in the world, research is have some problems. So when we start up any research at any level, even Western or Southern, everywhere have some problems. But maybe it's a low middle income countries, they have funding problems, more funding problems. Maybe they cannot, maybe they may not get proper guidance. So little bit, but definitely we can overcome when we target, or when we target the study, or when we target the appropriate scientists, or when we approach appropriate research area. So definitely is achievable. But the thing is, takes maybe sometimes a failure when we approach to someone. Maybe they may not support you. Sometimes they deny your invitations. Fine, maybe we can approach to others. So when we keep on trying, definitely they will invite you. They pleasure to invite you. But before that, you have to show your talent or something solid evidence. You have to show them. Okay, this is my contribution. This is my research outcomes. Then they agree to invite you, or they agree to accept. But without showing of any solid evidence, sometimes it may be difficult. They may not accept you to join their research team. So you have to show the solid evidence in terms of what is the evidence, mainly for maybe the paper publications. Also, maybe you can show your research outcomes, maybe small grant also, maybe within your university level, or maybe within the state level or country level. If you have a small grant, also it's very good for you to show your solid evidence. So this is my own research study topic. So with this area, I obtained the research grant from the national level. Something you have to show the solid evidence. With this, definitely you can achievable. But without any evidence, sometimes it's very difficult. It's not. So we have to achieve everywhere. Like research means not only for paper publications. We have to show the grants. We have to show the achievements. We have to show the research engagements. We have to show the student supervisions. So everything is involved. It's not only if you publish paper, nobody agree with you. It's a publication is a part of your talent, but apart from that, research talents is a different level. So once you fulfill, then only they may agree to accept. So these are the factors. But still, low middle income countries, researchers made everywhere in the world. They are doing better research. Even though the top researchers in the world from low middle income countries, we cannot say is maybe the opportunities, many of them they never get, but a few of them already at the top level. Okay.
Okay, thank you.
Thank you.
Linked with the thing that you just told about, so let me ask you another question. So how can early career researchers, ECRs, position themselves as impactful collaborators? What particular thing they have to do? What should they actually ideally do so that they can position themselves as impactful collaborators, so that other senior collaborators will probably choose to work with them?
Okay, the early career researchers, they have to find out their own research interest, their own research area. So let's say if they wanted to go with their research, they have to find out who is the best person, or who is the best researcher to join with them, like collaborative research work. before approaching them, they must have a solid idea, a solid plan. It's a protocol. So this is my research plan. This is the expected outcomes. This is the the objective aims, methodology, like expected outcomes. Once we achieve this research really is going to the next level. Something they have to show the proper plan. So everything is a plan. So they must have a plan. So without plan, most of the researchers among Asian early career researchers, they have interest, a lot of interest, but sometimes they don't have ideas. Sometimes they wanted to collaborate with the international top researchers, but sometimes they don't have plan. They have plan only with the collaborations, but what collaborations sometimes they may not they do not have proper plan. So the planning is very important. If they have a plan, definitely they will get the research partners.
True. I agree with that, because I get contacted by hundreds of young hearts who are very interested to do work with me, and I often ask the same question, like, what sort of work do you want to pursue?
Yeah.
How do you want to take it ahead? Because writing 1 or 2 papers is not what I'm looking at. I'm certainly not looking for even guest or ghost authorship. Many people are happy to give me just my name in their paper and publish it, but I am like, I do not want that. I never practice that. Otherwise, I would be having probably 500 more papers on my name. But I have never practiced it so far, and I'll never practice it. So my giveaway to people is basically that you should be ready with some vision, research vision, and then you get in touch with senior researchers and collaborators so that they see some value in collaborating with you. And that's the critical point in which the collaboration, the partnership begins in.
That's
so, okay, the next question, because we are talking about senior researchers and young researchers. So what role does mentorship play in collaborative research success? You have been a mentor to so many people, so I think you are the right person to talk about it.
Is a mentor is a play important role. Is a mentor actually if anybody have a good mentor, they can succeed. Motivation, especially the motivation. So even though they don't have enough knowledge, early career researcher or student level, but the mentor, if they encourage well, definitely they achieve a lot. Let's say example, some of the students, maybe they don't have ideas or something. Even my student, a medical student, when I was working Monash University. So the student actually is a first year student, medical student. The student came to me, how to publish paper is a very difficult. Sometimes, I'm not getting any ideas. How is very important? Is impossible for me to publish any paper or something. Then I bring him. Okay, are you interested? Yes, he is interested. So when he was telling me, so at that time I was working in my lab is alcoholic liver disease. So how alcohol damage of liver defense mechanisms, how alcohol damage of liver. So this is the lab research I'm doing, because I'm animal modeling. I'm doing animal modeling, lab research. So when I'm doing, he came to my lab around 15 days. Just he observing my students' research activities, how my students are doing animal handling, dose administrations, and blood collections. These are the basic things. Just he came to me observe for only for the observationship for 15 days. After that is one day he came to my office. Okay, if you allow me to write up some paper, I am very happy to write the paper. He was telling me. Then I gave some ideas. Within 45 days, he wrote a paper, nice paper. So then we communicated. So he published the first paper with a Q1 paper while he published. It means that he doesn't know about research. He don't know about what is research also. But mentor, if they really have a good mentor or supervisor, they can get motivation. Also, they can do any achievements like publications. Also, they go for grants or anything. So mentor play important role. My concern, If you really motivate our students, it means research scholars or young researchers, they can achieve a lot. Because our people, they eagerly waiting for the opportunity, our young researchers. If they really come to us, we can mold them or we can give a lot of ideas to them. So likewise, the student is the first year student. Within 2-3 months, he published paper with a Q1 journal. He's the first student he published. My student is within the first year. So why I'm telling this, the motivation way, as a mentor, we have to motivate our young research scholars or our students. Definitely they can do it. Is a mentor play important role. Is
Definitely.
not only for academically, sometimes personally they have to share their experience. Okay, sometimes the students come from somewhere. The environment also is very new for them. So sometimes they may not adapt with the situations, with the environment, new environment. Also friends also very new. So that times they do not know what to do. But the mentors have to give some support, mental support. Definitely the students will achieve a lot. So the mentor is play a major role.
Definitely. I completely agree with that. In fact, without mentorship, critical mentorship at the right time, I think many young talented people may go astray. They may go in a wrong direction, and there will be significant amount of damage.
Yeah, that's true.
So, the last two questions, I'll be very quick. In your view, how can collaborative biomedical research better guide and influence the health systems in low and middle income countries?
Yeah, it's a better. They find out the potential researchers. Once they find out the potential researchers, maybe 1 to 10, the ranking of 1 to 10, so they can approach or communicate through the email or any social media. Also fine. Nowadays easy. If they approach them, maybe they answer. Sometimes they may not answer. Also fine. Keep on trying. Definitely, so one day they will they accept your invitations. Simultaneously, you have to progress your research. Consistently, you have to show your research achievements. So these all good for you to connect with the people. So it's a very simple way. But sometimes it will take 1 month only. Sometimes it will take 1 year also. It depends on depends how you approach, how you are approaching to the people. So there are many factors. We cannot say within one factors. There are many factors out there.
Okay, so if we have to improve health systems research using biomedical research, so how do we improve that? What should be done?
This also is a very broad question. It's not like single question. It's definitely it's a biomedical research. It means it's a platform. It's like a bridging to the clinical applications or clinical practice. So once the evidence-based biomedical research outcomes, these outcomes play a important role, or maybe will give open the idea to move on to the clinical applications or clinical research. So after clinical research, we will get a lot of therapeutic approach or therapeutic intervention and patient treatment, patient care, patient management. So these are the further steps. But everything is what I said before. Everything is a interlink. It's a interconnected. So we cannot separate as a biomedical research is separate or public health is separate. Everything is a interlink. So it's a group of people only. We have to have a collaborations. Otherwise, we cannot achieve more and more. So sometimes the outcomes is very limited. But when we have a good collaborations, the outcomes also better outcome.
Yep. Okay.
Yeah.
Okay. The last question for you, Dr. Vetri. How can this collaborative effort between biomedical scientists and public health, so how can that inform and strengthen the global health?
Always strength only. There is no any demerits. Always merits. So they must have a collaborations. Biomedical research scientists, public health expertise, they must have a collaborations. Then only they can get better outcomes. sometimes the public health expertise, they're seeking of some advice, or sometimes they're seeking of some clarifications, evidence-based some reports. Maybe the lab scientists or clinical scientists, they may provide them to give the statistics report, particularly the study report. These study reports is very helpful for public health expertise to plan for some research studies, also to go for it's a better research plan and better research outcomes.
Wonderful, wonderful. Thank you, Dr. Vetri Selvan Subramanian. It's such a pleasure listening to such insightful lecture and then this moderator panel. I think I have learned so many beautiful things and very interesting and insightful things from you. And I'm sure our young people, young researchers who have been listening to you on YouTube as well as on MS Teams have benefited. And those who will listen in asynchronous mode later, I'm sure they'll benefit from that as well. So if anybody wants to ask any question, we'll allow 1 or 2 questions. And please raise your hands and the admin will allow you to ask questions straight live, because we are getting late for the next panel. We'll not be allowing other people, many people to ask questions. Okay. So Sadiq wants to ask question. So admin, could you please enable Sadiq to ask question? Please be quick. Or you can, Sadiq, you can ask question. Are you able to unmute yourself? Just 2 people. We'll not allow more than 1. More than 2. Sorry.
Good evening, everyone. Am I audible?
Yeah,
Yes.
we can hear you. Please proceed.
Sir, I am from social science background. So how we can collaborate with the people from public health or science background? So when I hear from you, you are people talking about science, social health issues. So I think is it the right platform for me to learn? Actually, I am learning from you, but I am confused. So can you please share something about it?
Sadiq, social science is very important. You are the people, you are going for survey research studies, statistical part. Many of my researchers also background is social science, particularly some community projects, some strategy projects. Some researchers belongs to social science. They do communication with the people. They get interviews, also the question-based discussions. Also, they move on for the questionnaires, survey studies. They all do. It's a social science is a part of health research, health research studies or health research. They can involve. There is no restrictions.
Social sciences are a gamut of sciences. Huh? Okay, Sadiq. So you people, social scientists, play a major role in health research. You must know this. So you are in no way alienated or different from us. You people play a very active and very major role in the research that we do on a daily basis. So it's all about imagination. There is saying imagination is the only limitation. So the more you imagine, the more you study, the more you think, you will be able to identify and connect with us, and we'll be able to connect with you as well. And we'll be more than happy to collaborate and think about planning systemic, So what we are thinking about is systemic perspective, and systemic perspective is impossible without we actually talk about social sciences, because what we are researching on, humans, people, right? So who are these people? These people live in society. So how can we think about any health research without people-centric and social sciences research, right? Okay, yes. So we go to the next. We don't have a lot of time. The panel should have started at 7 o'clock. It's already 20 minutes late. Okay, so we have to go to the next. The second person is Jusu. Jusu, please allow Jusu.
Yeah, thank you very much, Professor. So quick one. How can we ensure that research recommendations are effectively adopted and implemented by policymakers, government, authorities, funding agency, and other stakeholders within the collaboration that we are talking about? Thank you so much. That's my question.
Thank you, Jesse. Jesse, right? You are from?
Jusu, J-U-S-U, Jusu.
Jusu from?
Jusu from Sierra Leone. Jusu.
Juicy from Somalia.
No, from Sierra Leone. Sierra Leone.
Okay, okay. Nice to. Thank you for your question. Actually, you must have a plan on your own area of research interest. If you have own research interest and concrete evidence based outcomes, maybe you have a concrete ideas, definitely you can collaborate with your own area of researchers. Shouldn't be a problem, but consistently you have to show your research progress, your achievements in terms of research outcomes, publications, and social engagements. So what kind of engagements so far you have done within your level or within the university level or within the regional level? So likewise, if you have a concrete the evidence-based progress, definitely you can have a good collaborations with anyone.
Okay. Okay, great.
Thank you, Josie.
Thank you. Thank you. Farjana, Hazel, please enable Farjana to ask question.
Thank you, sir, for giving me the opportunity. I'm Farzana from Bangladesh. Now I am a student of Yonsei University in South Korea. So actually, I was working in two research when I was in Bangladesh back. So in this research, actually, you highlighted that the funding is a great problem for us. We have many ideas, we don't have fund. But when I am in Korea, they are like asking to us that Koika is a organization, or there are many organizations in Korea also, like they are from the government of Korea, but they are actually giving from 1 million to 10 million opportunity. This opportunity, I am thinking that this group of 160 people from whole world. So these people should know about the funding opportunity. Like today, our professor also mentioned about few options. So these options and the funding areas, what are they funding for? So this should be a session that we can know about our interest and also the funding opportunity we have, so that we can make our own proposal and we can also have a good funding. Thank you, Professor.
Thank you, Ms. Farzana. Thank you for sharing and enlightening ideas to our people. But actually, so I have a few collaborators from South Korea. They do have actually a lot of fundings. As you know, many of Indian researchers also they're working. They every year they have policy, the university fundings, also the scholarships scheme. It's a very high. But certain countries they have a lot of they have the policy like they spend a lot of money on research and research development. But some countries may be very limited. But of course, opportunities are very high. They must try. Our researchers sometimes they may not try. Maybe one time, two times they try. If they failure, they disappointed. But keep on try, like Farzana. How Farzana got it? He's keep on try and consistently have to try. Even some of my students from different they also got to Spain. They also went to Spain, and some of them, my students also went to Antwerp universities, Western countries. Like some of them, they went to Norway. Some many places. One of my students, my university, they never accepted, but the student got Canada. So now she is in Canada. Likewise, when consistently the researchers are searching, they get a lot of ideas. Like Farzana is one of the example from Bangladesh.
Definitely. I think we gave everyone a fair chance. Thank you, Dr. Petri Selvan Subramanian, for taking out all the time for speaking with us today evening. And it was wonderful to listen to your brilliant, insightful, illuminating talk, as well as the panel discussion, and sparing so much of valuable time for listening and answering all the questions that people had to ask. I'm sure our young researchers have benefited out of that. Please note that this particular program, that Advanced Certificate program that our Global Consortium and BIHR are offering, we are not only offering them a certificate of completion based on grading and very rigorous process of work. It's a very intensive research process that they are going through for the next 10 weeks. So on the completion of this research program, I just want to let everyone know on live call, as well as you, because you are new. So on the completion of the program, they will receive a certificate of completion of advanced certificate program. Besides that, they will also achieve a statement of higher education achievement, called SHEA, offered by top universities in the UK and Australia. So this particular document will have their grade written on it, and that will also be your signature, because you are now one of their teachers, because you have taught them for one session. So it will have your bearing of your signature on that. So our admin will be in touch with you for that purpose in due course. So please oblige, and we'd be very happy to have your signature on the certificate. And I'm sure our participants would be very proud to have your signature on their statement of higher education achievement. So with that, I think the panel gets to a halt. And so thank you so much. And now I hand over to Faisal to do the dues. Thank you. Yeah. So yeah.
Once
So
again,
we
thank you,
resume
everyone. Thank you, Prof. Maheswar and Hazel, for giving this opportunity. Thank you, everyone.
It's our absolute pleasure. Yeah, it's our absolute pleasure, Dr. Vetri. We'll be in touch with you with the photo and request for your signature. So please stay in touch, and we shall be getting in touch very, very soon. Okay, thank you. So yeah, you may please leave, or you may
I can
be
leave
there,
the
whatever you prefer.
Thank you.
Okay, okay, thank you. See you.
Thank you. Bye.
Okay, we shall resume the meeting again at 7:30. So may I request our next panelist, Professor Arup Mahanti, to take a few minutes just to get refreshed, because your panel will start sharp at 7:30 p.m. Indian Standard Time. Thank you. So the participants, please don't go away anywhere. Just go to the loo, take some time for getting fresh air, and come back as soon as possible. And ask your friends, those who missed the important session of Professor Vetri, to come back and attend another very enlightening talk given by our very own infectious disease specialist, Professor Arup Mahanti, who is already on board now. Okay, Arup, are you able to hear me?
Yes, sir. Yes, sir. So I'll be there in 2 minutes.
Okay, please join. Yeah, sure.
Okay, sir. Okay.
Hello. Hi, Arup. Can you hear me? See me all right? You are on mute. Can you unmute yourself?
Yes,
If
sir.
possible. Okay, great. Okay. So now you are on spotlight. Wonderful looking, handsome face. So I'm taking the first look of your face. Good.
Okay,
Okay.
sir.
Now, okay, we'll start. Faisal, are you back? Okay, let's start. Okay, great. Thank you, Faisal. Okay, so may I request before I start the session that please stay muted, do not talk. Okay, if you are not in a condition to attend the meeting, please leave and rejoin. Okay, do not turn on your camera, do not talk. Okay. Professor Dr. Arup Mahanti, Associate Professor, Department of Microbiology, AIIMS Gorakhpur, India. Professor Arup Mahanti serves as an Associate Professor in the Department of Clinical Microbiology at AIIMS Gorakhpur, an eminent institution of him, and he's a highly accomplished medical academician. He holds an MBBS and an MD in clinical microbiology and a postgraduate diploma in infectious diseases. With a profound interest in infectious disease research, Dr. Mahanti has authored over 250 scientific publications, including approximately 140 papers indexed in PubMed. Internationally recognized for his contributions to monkeypox research, he was recently listed among the top 10 scholars globally in this domain and top 2 in India. At AIIMS Gorakhpur, he holds several key responsibilities. He is the in charge of the TB laboratory, infection control officer for the hospital, public relations officer, and the officer on special duty, OSD, the executive director. Uh, Hazel, can you please spotlight him? Yeah, thank you. Okay. So beyond academia and administration, Dr. Mahanti is also a passionate sports person. He captains the institute faculty football team and previously represented his school at the national level in badminton. His leadership in both professional and athletic arenas reflects his commitment to discipline, teamwork, and excellence. Dr. Mahanti is driven by a mission to advance infectious diseases research and strengthen public health systems through evidence-based practices and institutional collaboration. So, with this introduction, may I request Professor Mahanti to please do the honor and illuminate all of us with his wonderful lecture. I look forward to listen to your lecture and probably learn a few things. And I'm sure our participants, emerging researchers, will learn many things. So, Dr. Mahanti, please.
Okay. So good evening, sir. So thank you so much for the wonderful introduction and for the opportunity to present what we have done over the past 3-4 years in the field of research. So Faisal, can you please present the presentation? Okay, and can you make it yeah, in slideshow? Okay, so so the topic which was given to me was a very interesting one, and I've tried to collaborate what we have done, and we'll try to give some information to researchers how to collaborate infectious health and infectious disease and public health. So the next slide, please. Faisal, the next slide, please.
The team, please cooperate, coordinate.
Okay.
No.
So yeah, this is the second.
No, the previous one. The previous one.
Previous one. Okay. So before jumping onto the whole presentation, and just a brief, because I think we have a lot of young researchers here who are just starting with their field of research, and this is a slide which everyone should know, as in how we can start from basic till complicated kinds of research. So generally, as we are all working on human, because we are all clinicians and working on human subjects. We don't work on animal and laboratory studies. And then we have got case reports and case series. A lot of case reports and case series are there. People start their career writing case reports, and then they progress into case series. Then we have got some case control studies in which we just look onto our past data and try to have a comprehension of the past data and then make it into a research paper. We have got cohort studies. Then we have got RCTs. So the RCTs are generally written by people who are working in drug trials and who are working in clinical trials, who are trying to do some kind of intervention. And at the helm of the pyramid is the meta-analysis and systematic review. A lot of young researchers want to start with meta-analysis from the beginning and do systematic reviews, but this should not be the starting point of your research career. It should be after you are able to write at least a proper original paper or a case series or a other kind of research papers, and then slowly you should gradually progress onto the systematic review and a meta-analysis. The next. Okay. So what is the writing process? This is the complete writing process, as we are all interested in publication. But before we jump onto the publication, we should know what do we want to do. So this is the starting point where we want to start. So we have to have some kind of a purpose, as in what we want to write on and who are we going to write it for, whether what kind of audience are we going to pertain to. And that is the pre-writing step where we want to focus on our topic of interest. Then is the stage which comes is the drafting stage, in which we don't jump onto a topic. We just first write down some ideas, and as we write down the ideas, we want to explore newer ideas, as in what do we write. Then is a revision stage, in which we ask our peer groups or we ask our seniors, in which we ask them whether we have done the right steps or we have done the right processes. Have we chosen the right topic first? We don't want to jump onto a topic and then at the end realize that this is the wrong topic. And finally, we go for the editing and the proofreading stage, in which we correct our errors. So nowadays we have got a lot of paid softwares which help in doing this. But the best way is to go do it manually and try to involve a senior of yours who can do some kind of correction in both spelling and grammar. And then finally, we share it for publication. We send it to the journal, and we hope that the journal accepts our research manuscript, and it publishes it. So the entire step, this entire process has to be employed for every kind of research paper we want to write. We should not be jumping on from one step and bypass the other. It should be followed for every paper, be it a case series, be it a case report, be it an original article, or be it a meta-analysis. In terms of meta-analysis, this whole process may take a lot of time, but it should be used. Next. Okay, so this is how an anatomy of a scientific paper looks. So with Sir being the moderator, he must also have started from this only, and then only has reached what he is today. And we should not forget what is the whole gist of writing a paper. Ultimately, we want to write a good paper which is of some importance to everyone. So the first thing is we select the title. We have the author information here. Then we write an abstract. Then abstract basically is the summary of the entire paper. What happens is, whenever we are asked to read a paper, we generally don't have time to read the entire paper. So the abstract is the thing which we look on the first instance, and then we assess the quality of the entire paper. Suppose, for example, if you're doing a systematic review and we have to read 100 papers, we will read the abstract first. So the abstract has to be the best part in the paper, but it is generally the otherwise. People write up the paper first, and then they, before submitting, they write the abstract just to finish the submission process. So the abstract has to be very, very clear and concise. It has to supply all the information which we want to do. Then we have got the introduction, which I'll come to later on as in how to write an introduction. Then we have got certain results which we want to discuss, and then we have a discussion. We cannot write the discussion without having the result, as in an original paper, because the results is the discussion is basically comparison of what your results are versus the results of the other studies. And if there are no studies, then you just publish your result. Then we have got the materials and methods, and then we have got certain references. So this anatomy of a paper has to be kept in mind whenever we want to start a paper, and whenever we want to write a topic upon that. Whenever we are doing that, this has to be kept on the left side, and then we start the entire process. The next slide, Faisal. Okay, so again the same step. So as in, how do you do a literature review? So whenever we ask a young researcher who is just starting his research process on doing a thesis, what do you understand by literature review? He says, they are done with it. PubMed is not the place where you will find the literature for every paper. You have to find the other search engines also, and then you have to go for the literature searching. Then you have got a summarize, in which you want to summary. You have to have a summary of what you have tried to find. Then you define your argument, whether your question and your research is going to solve the particular problem. Then you have got a detailed argument. So literature review has to be a document which is basically going to review your thesis or your topic of interest with the priorly published papers on that, and you have to give comparison of what you are going to find. This literature review cannot be done unless and until you have your results. People do the literature review before having the result. This can only be done after you have your results from your study, and then you communicate your findings to the other public by publication or by presenting in a conference, whatever means you want to do. So the entire literature review has to be very concise. It cannot be done in a day or two. It might take 2-3 months to have a very good, concise literature review for you to be presenting. Next. Faisal, the next slide, please.
Please be quick.
So can I take the control of my presentation from here only?
Can you do that?
I think so. I've asked for the request because. Okay, so can I share it, or you want to continue from there?
No, I would suggest that you please project your own. Yeah.
Okay, sir. Okay, sir.
Because Fraser seems to be experiencing some lags on his computer. So participants, please bear with us for a few seconds.
So can you see the presentation, sir?
Perfectly. Please start the slideshow mode, please. Slideshow.
Okay. Oh, yes, sir. Is it okay, sir?
Yes, perfect.
Yeah.
Thank you.
So okay. So this is a very simple diagram in which I wanted to show, as in 1 second. Yeah. So so the first thing is we make an observation. We see what we want to observe, and we observe something. We form the hypothesis. Then we perform the experiment, we analyze the data, we report our findings, and then we invite the others to reproduce the same result. So this can be basically, this looks a very complicated thing, because here most of us go wrong. We don't make the right observation, and we end up forming a wrong hypothesis. So this has to be very, very clear. Okay. So as in, we're going for a certificate program where we have a lot of people from different fields. So this is the most important thing, in which what the other person is telling you, whether that topic is going to interest you or not, depending upon what you are working on. For example, if I am an infectious disease expert, I might not be having a lot of interest in the field of mechanics or in the field of environmental sciences, but the topic has to interest you. And if the topic is interesting you, does it answer a specific question? Number one. If it is going to answer a specific question, we have to see whether it is unique. There is no point in doing research which has been done priorly and which has been done previously by some other person in different country. It has to be something different. It has to be something unique. And if it is unique, whether some questions are still open for it. So if the research question is unique and if the topic is interesting, if there are certain kinds of opening in the questions, we should go and do the study. But if the research question is not answering a specific question, we should narrow it down, and then we should add certain kinds of indicators, whether we are adding to add a time context or a physical context. So the research question, ultimately we want to work on a topic which obviously we cannot find a new topic every time. But if we are going to work on a topic and it has been done previously, we have to add certain parameters to it so that people are going to read it and it is of course some interest to the public. So here comes the 7 research gaps which we talk about. So we have got an evidence gap. So evidence means that there is some gap in which there has not been, for example, the evidence between discussing of a investigation, there's some evidence gap. There is some kind of knowledge gap in which we try to do a gap study and we see the difference in the knowledge perspective. There is some practical knowledge gap, methodology gap, empirical gap. So any gap which we are able to assess, or any gap which we are able to find or work on, we should be able to do that particular thing. Okay, so this is what again, there are different kinds of papers which they try to produce. So this is the guidelines for structure, formatting, references. I think everyone knows this. I'm just going to be very quick in this. So the structure of the paper, as I've discussed in the previous slides, the formatting the paper, finding the right reference, using the reference, writing the paper, and doing some kind of literature review. So this was as I say, we give very less importance as in how to write an abstract, but Nature had actually published a paper in which they taught us how to write an abstract. So they have told us that an abstract basically has to be very, very concise. It cannot be different for sir is writing some other abstract for a paper and I am writing some other abstract. It has to be following a certain guideline, and this is the guideline which they gave us. So for example, they gave us 1 or 2. So the abstract basically has to be 1 or 2 sentences for the basic introduction, 2 or 3 sentences on the detailed background, 1 sentence for the general problem, 1 sentence on what we are trying to find the result. So if we see an abstract, we generally find introduction, background, materials and methods, and result and conclusion. So the abstract has to be the best part of the paper, so that people, after reading the abstract, want to read your paper in detail. So this is a slide which doesn't get a lot of importance in a lot of other presentations, but the first step is the most important thing. The team has to be the most important and the most time taken process, because this is the team which is going to stay with you forever, and this is the team which has trust within them, a team which can be formed within with researchers from different backgrounds, with different professions, from different countries, and this is the team which is going to help you in publishing, in publishing papers, in giving up ideas, in forming new ideas. So I will encourage all of the young researchers to first form a team and then start the entire process. So this is the so once we have a team, then you can formulate the research question based upon the PICO format. Then you create a review protocol. We conduct it through thorough literature. We select the relevant studies. Then we appraise the quality of the study, whether the study has been published in a good journal or not. We cannot be taking a journal, we cannot be taking an article which has been published in a pirated journal. For that, you need to know whether the journal is actually indexed or not. So then you will extract the data from the studies, we analyze it, and then we report what is known and what is not known. So you have to report both of them. It cannot be that you only report the known findings and you don't report the unknown findings. So the team formation is very, very important. Again, one of our friends, Asad, who is very active on LinkedIn, I have directly taken the slide from him, and this basically shows how to write an introduction. So the introduction basically has to be a background. We write about the existing research, what is already there in the literature. Then we define the gaps, which I wanted to focus on. Which kind of gap do you want to fill in? Whether you want to fill in a research gap, a evidence gap, or a knowledge gap. Then you write a hypothesis, and then you write the aim of your study. This introduction paragraph has to be uniform for every kind of research, whether it be a systematic review, whether it be an original article, whether it is a meta-analysis, so that when a reader is reading the introduction, he knows what gaps we have trying to focus on. Again, this is a very this slide is very difficult, but this is a very easy slide because it actually tells us how to write a paper and how to go about it. So the abstract, which we have already discussed: introduction, literature review, methodology, result, discussion, conclusion, acknowledgement. So every section has got subsections in it, and every subsection has to be filled. You cannot be just writing a story in literature review or methodology in or whatever you want to write. So for example, if you just take the discussion has to be the introduction, then the evaluation, and so that we are trying to compare what we want to compare our results with the other person's results. Again, the same thing. So whenever we want to start with a literature topic, or we want to do we want to start with a question, generally the seniors tell us choose a topic which has got a wide interest. Wide interest means it is able to attract people from every field. For example, if I am going to write on tuberculosis, this tuberculosis will be of interest to the person of public health, to a person of community health, to a person who is working as a physician, to a person who wants to implement certain kind of programs. So this topic, for example, has to be a wide interest. For example, if I want to write on global warming, I will probably get 1,000 citations if I write a good paper and if it gets published in a good journal. If I write on immigration, write on cancer. So this topic has to attract people from various groups. Then we do a brief literature search, and then we see whether certain people have not been able to address certain questions. Those gaps need to be addressed, and those gaps which need to be addressed should be the basis of our paper, whether we see whether that gap is really very bad and whether we are able to fill the gap. For example, if we want to work on cancer, we see whether this cancer therapy is right or not, whether the cancer investigations are being available to rural population or not. So that kind of gaps need to be filled up, and that should be the basis of our research question, and then we go on that particular research. So working on a field which is a very rare entity or a very narrowed down topic will not be helpful to the general public or to the general population. So again, I'll skip through this slide. So this is basically the same slide in which we want to write a summary. A lot of journals want summary or conclusion at the end. They have an abstract format also, and they have a summary also. So this is basically a summary or a conclusion where we try to give a gist of the entire topic. There's a difference between a summary and an abstract, and both need to be different. Okay, for young researchers, because my topic is combination of both. For young researchers who want to start their process, I would relatively request them or advise them to start with small papers. You cannot be writing a meta-analysis. So this is some important information which because this is how I started my whole career. So we have got letters to editor, and letters to editor are different. You can write a letter to editor to a very good journal like NEJM or Lancet, but the topic has to be concise, it has to be quick, and it has to address to a particular question. So I'll skip through this slide. Again, we have got certain things called as correspondence. So for example, a correspondence can be a correspondence written to a already published paper. For example, if sir has published a paper in Lancet Infectious Disease, and I think that certain perspective has not been addressed or certain additions can be made, I can write a correspondence to that particular article published by him. For example, I can write a letter, and this letter cannot be more than 400 words. It has certain specifications, and this is a good start for a career in which you can gain some confidence by publishing in good journals. We also have got commentaries, correspondence. We have got some diagnostic challenges. I'll show some of our research in just 5 minutes, which will help. I'll try to explain how we did that, and how we collaborated with people from different fields and we published them in quick time. So this was the first paper which my team, which was led by Dr. Ranjit, this was published in COVID. And this was the first case of COVID in Nepal, which was published in the Lancet Infectious Disease. This was a huge step for us because Lancet is something which people dream of. And being a young researcher, if you get published in Lancet, then you have that confidence. So if you see this paper, you have got people from everywhere. You have got people from Nepal. You have got people from Colombia. They are the doyens of infectious disease, and they are people who have helped us edit the paper, who have given us certain additions, have added certain findings which we could not address. So this was the first correspondence which was published in the year 2020 when COVID was at its peak. And it was difficult for us to even leave our labs and publish papers. Probably we could not publish a lot of papers because we were more involved in diagnosing the COVID disease rather than we could publish. So, but still, this was one paper which was published from our team, and this was the X-ray of that same individual, which was the first case of COVID. This got published in Lancet Infectious. You can find the paper in the journal. Okay, I'll skip this slide. Not of importance. So if you see this, the second paper, there's some very few papers. So again, we have got a lot of people from India here, a lot of people from different parts of the world like Colombia, US, Nepal. And this was the paper which we wanted to emphasize when the COVID was going on and the Football World Cup also was being organized. So this was a paper which was of public health importance because we wanted to show people that you cannot be having the monkeypox and the COVID pandemic both at the same time and having the World Cup also. So this got published very, very fast. So, and this got published in a journal which had an impact factor of 39 at that time. And all of these people, except for 2 or 3, are young people. They are hardly less than 30 years of age. So this is a paper which was published in TMID. The same paper which got published. This is a very renowned infectious disease journal, and this publishes letters to editor and correspondence. Okay, so this was my first paper which got published in the Lancet. This gave the thrust to me that I also could write some good papers, and this was my paper which was published in Lancet on monkeypox. So here we published the first case of monkeypox in India, and this monkeypox case had come to Kerala at that time. So this was a time when India was getting cases of monkeypox. So if you can see, talking about collaboration, we have got people from Nepal. We have got people from, he is from, I forgot the country. He's from somewhere in the Middle East. She's from IMS Delhi. And he is from, again, from the Middle East. So a paper which got published in, I think, 1 week. If you can write a paper and have a right structure, even Lancet can even publish your paper. And this was a second paper. This got the maximum views. So this was a paper which we collaborated between public health and vaccine. So emergence of rabies among vaccinated humans in India. So so choosing the topic was the right thing. This was published by the team from PJ Chandigarh, and this got the maximum views. Gave a lot of good vibes and good confidence to people so that we could publish. This got published in Lancet Regional Health Southeast Asia. A very small paper, but it was of great importance to the public because it could show that there is still a grave public health concern of rabies emerging as a infectious disease in vaccinated humans. Okay. So now you can also publish personal views, you can write viewpoints, but what I want to emphasize here is that you should know what you are writing and what you are going to write upon and the clear specification of the journal. Suppose you are writing a paper and you write 1,000 words for a commentary, it will get rejected the first day. So you need to be very, very specific on what you want to write. Talking about collaboration between different countries and public health, this is a paper which got published in the BMJ. And this was a paper written about girls' education and future of healthcare in Afghanistan. I could never think of such a topic being an infectious disease fellow, but this was thought to be given by a person in Afghanistan. He gave us this topic to write, and he wanted to emphasize on the future of healthcare and what is the role being played by women there. And this got published within 1 week. Again, a good collaborative approach. So the collaboration led to this got probably, I think, 30 to 40 citations in one day. Again, a good collaborative approach. Okay. Infectious disease and public health. Infectious disease and public health means that you're going to write upon infectious disease and you are going to give the public a good message. This is a rare disease which has spread in the American subcontinent, and here we could emphasize upon the virus, which is the Oropouche virus, and the deadly transmission from mother to baby. So this was a potential new mode of transmission, again written through collaborative approach with our team, people from Colombia, people from Australia. Vasu ma'am is from Australia. She's an infectious disease expert and she collaborated with us. So a paper which could be written between different people from different regions, public health experts, and you could write and pass on a very strong message that this virus is a new potential means of transmission between mother to baby. Why I wanted to emphasize this slide again, because of the role collaborators can play. I have seen a lot of dengue cases in my life, but I never could think that dengue could also have myocarditis. We all see dengue, but this was a systematic review and meta-analysis which got published in a very good journal in which we showed the prevalence of myocarditis and dengue. So now we are working on a lot of other extra manifestations, for example, pulmonary edema in dengue. People who are all working in the field of infectious disease can also work on certain a lot of ideas can come. You can work on pulmonary edema, you can work on other manifestations. So a very good approach which can be taken up to write such systematic reviews. We have done some considerable work on monkeypox, because monkeypox was the pandemic which came after COVID. So we again wrote this paper, and this got published in the Journal of Dental Association. Very, very good, high emphasized journal. And here we just chose one topic. That's it. We wanted to emphasize on the oral manifestation of monkeypox, what all monkeypox can cause in the mouth. This also got very good acceptance. People from all over the world, they wanted to ask us, how did you collaborate and how did you could write? So just choosing one specific topic, and rather than writing a complete comprehensive monkeypox review, again a very collaborative approach was taken here. We wrote that. Okay. See, similarly, we wrote a monkeypox review. So here we wrote about the use of antivirals. When monkeypox had come, there was no treatment. There was no specific medication which could be given for the disease. And this was a paper which we wrote initially, in which we wrote about the different kind of medications and antivirals which can be used. Based upon this systematic review, a lot of medications and a lot of guidelines were made. So this is how you can work on writing a paper and hope that your paper is of good importance and it can be of some kind of public health importance, and you actually help clinically in giving the right message to the clinicians. This paper was from our own region, from Gorakhpur, where I'm working right now as an associate professor. Hand, foot and mouth disease is a very rare disease, very, very rare disease, which generally happens in cattle and in cows and in buffaloes. This outbreak was seen in Gorakhpur, where we had certain children, and we took samples from these children. We sent it to NIV Pune. They published this, and this was again published in a very good journal. So if you see this paper, only 4 authors are from AIIMS Gorakhpur, and all of the other authors are from NIV Pune, which is the premier institute for virology in India. Again showcasing the role of collaboration. So how you can send samples, how you can help in diagnosing the disease, and how they helped us in finding out the right organism. One more, this is the current outbreak. If you can see here, this has been published in 29 January 2025, the same year. This CCHF fever outbreak is still going on in India and the state of Rajasthan. And again, we published this in TMID, in JTM, which is a slightly better journal than TMID. So this was published. This was a topic which Sir had initially Sir wanted to write with us, but I think we wrote it before him, and we wrote this paper because this was of good interest to me. I am very interested in virology, and this was the human metapneumovirus. We wrote it I think 1 or 2 days when the outbreak was happening, Thankfully, the outbreak has finished, and this outbreak has now engulfed few countries, but it was not of very great significance. Besides writing articles, we can also publish figures. So this can be of interest to people in the group who are practicing physicians or practicing doctors. That if you see certain good image, if you see certain good clinical image, any JM, which is the premier journal in the field of medicine, can also publish images, and you can send these images directly to them. You can see this was published by Dr. Ranjit in 2019, where he published a case of diphtheria in which you can see the fascial patches on the tonsil. So it is not only writing big papers and big articles, even good clinical images with patient consent can be published in very good in high indexed journals, and you can write a small paragraph. So this could be a good image. Again, a case series of Paragonimus is very rare. These from Nepal got published. So I'll finish up my presentation, sir. The only thing which I wanted to I think this is my last slide. So this is the I'm not very good at statistics. That is why I'm very clear in this, that whenever I need a help from a statistics, I take help of my friend who is the best statistician and the best friend I have. So you should take help from people in topics which you do not know. There is no point in knowing everything. You should be good at your field. This is a table which will help the young researchers in just knowing which statistical test to know. The ultimate aim of collaboration is to trust each other and to hope that you end up going in the right direction, because publishing one paper is not the aim. The whole collaboration should last for lifetime, and this because at the end you have so much to do that you will not be able to do those, and you will need more team members. You will need more team members, young people, senior people who can guide you throughout your journey. So at the end, I would like to thank sir for the opportunity. I'm a novice in the field of this, but I hope I could do some kind of justice to the young people which we have in the group, and I hope I can be able to answer.
So Professor Mahanti has been like full of contagious energy. He is an infectious diseases researcher, so he's extremely contagious right now, and I'm already infected by the energy that he presents. So wonderful, excellent presentation. I think our participants needed it, and I was actually having a hard time thinking how we can include this in our training program, because we are having such an intense research training already happening by tutorials, and how can we have this kind of training, because this is required, because many people are at different stages of their career again in their training, their understanding. So I was thinking that, and thanks for doing that. Even I was not expecting, honestly, it was not anticipated, but it came like a kind of something as a serendipity. I think it's very useful. Someone wanted to ask question, but sorry, we cannot allow you to ask any questions. So now we'll go quickly into our panel, because that is the most exciting part of our today's evening. Okay, so I'll not waste any further time, because we started very late, and we have a long panel planned. There are about very few interesting questions which I have set up for you, and I hope they are not very tricky for you. I hope you will enjoy listening to them and also answer them, so that our trainees can benefit from them, because all that we have is the time, and all that we have is the experience, which we can share with our participants.
Sure, sir.
So the question number one. So I will not call you Dr. Mahanti. That sounds very formal. I'll just call you Arup. I hope that
yes,
is
sir. Better for me. Better for me. Sir.
Yeah. Okay, Arup, thank you for the consent. Question number one: what is the current state of collaboration in infectious disease research in LMICs? What is your view on this? How is it progressing and evolving?
Okay, so one second. So infectious disease, what I could, because I have been collaborating with people over the last 3 years. We could not collaborate much during COVID, but after COVID, when I was contacted through some people from Nepal and some people from the American countries, we started collaborating. There's not the collaboration is not as such as great as it can be, because a lot of infectious disease are there and a lot of variety of diseases are there in India and Bangladesh, in countries like Malaysia and in countries like Indonesia. But the scope of research which can be done is still not being fulfilled because of the reason that the communication and effective groups are not being formed which can help in doing such kind of research, because the people from the Western, they come to India to see infectious disease because they don't have infections in the US and they don't have infections in the Southern American countries. All the infections are there in India and all the infections are there, and it is very sad to say, but we are the domain of and we are the storehouse of infectious disease. So a lot of scope for collaborative approach is there. People don't probably value that much because we have not been able to produce that much research. We have the disease, we have the data, but unfortunately, we have not been able to reproduce them in terms of high indexed research papers or publications because probably we are short staffed or we don't have the facilities, or probably we don't have that kind of mindset. So I think the scope is there and we are lacking far behind in terms of doing good justice to our own field of infections.
Hopefully, in the future, those collaborations will take the shape.
Definitely, sir. Definitely, sir.
And I certainly look forward to collaborate with you on n number of papers as long as I am alive. So I'm looking.
We'll be very happy to collaborate, sir. Definitely.
Yeah. So like I'm not a trained microbiologist or anything, but whatever knowledge I possess humbly, I am always ready to collaborate. Okay, the next question to you is like it's a little related. Who are the critical actors when it comes to successful and comprehensive infectious diseases research? For example, epidemiology and healthcare, both clinical as well as epidemiology, public health. So, and how do we bring them and keep them together to be motivated enough to work together?
Okay, so because I'm a trained microbiologist and I always wanted to work in the field of infectious disease, I did not have a concept of public health per se. What does public health mean? Why are public health people so important? But lately, sir, when I've started working with people from public health, be it community medicine, be it a statistician, they are of great help because just to spread the right kind of message and to spread the right kind of message in terms of the disease which you're trying to cover, in terms of prevention. For example, there's no point of talking just talking about a disease and how you are going to diagnose it. You need to have a public health expert there in your team so that he can guide you as how to prevent the disease from the next time, because we cannot be having COVID every time. So the public health measures, the ways to prevent one disease to go from one country to the other country. So these are so I think there is no point of a public health expert to work alone, and it should be made mandatory that whenever you're trying to write on a infectious disease, you should have a public health expert. You should.
You're on mute, Arup.
Can you hear now?
Yeah.
So I think it is imperative for every infectious disease guy to have a public health friend. I think you should call them as a friend because then only the collaboration will be good. The public health person should be there with them on their team so that whatever you are missing on, they should be able to cover you for that. So I think public health and infectious disease will go hand in hand, and they are the people who right now are the forming a team, be it an infectious disease, be it a pediatric specialist, be it an ID physician, be it a medicine guy, be it a person who is working on mathematical modeling, who is working on predictive modeling, because there are people who can do modeling, who can mathematically analyze and can say whether disease is going to happen in how many years. So you need all of them to work together. Because there's no point of being alone and writing a topic which is just going to interest you. It should, if you write a topic with everyone, probably it might take some time, but it will help the public in various ways.
Definitely. So, but still, I need to listen a little bit. And how do you bring them is understood. But how do you keep them together to be motivated enough for a long time?
So I could not answer that part of the question, sir. To bringing them is also difficult. But once you bring them, to keep them is more difficult. So the best way to keep them is to be involved in projects, be involved in writing. Don't let them go, because what I have experienced with my team and with my friends is that you should always be working on certain kind of projects, and you should never have a gap in that entire process. So we have started in the year 2020 as people who are would be in the field of medicine here. It is not easy to write papers and to also practice medicines and to also see patients and to be in your own personal space. But with people like them, if you have them in your team, they are the ones who are going to motivate you to keep writing, to keep searching for new ideas. So the answer to this question is that you should always keep them busy. You should never let them go. You should keep them involved in every project of yours, so that they are not free. They are always with you. You can submit new proposals to the funded projects. You can write new proposals. You can write new papers. So the answer is never let them go. Just keep them with you.
Definitely. So I think the charity begins from home. So I'll start with you. I'll not let you go, and I'll keep you busy.
Okay.
The third one. So how do institutional partnerships shape research outcomes in your experience? And how do you leverage the cross-institutional platforms and their resources and capabilities in India?
Okay. So as in India, because right now I'm working in a central government institute. So as in AIMS. So right now we have around 23 AIMS in the country. In every state we have one AIMS. So what we have done is that we have formed WhatsApp groups of microbiologists in every AIMS. For example, if we have got 2 microbiologists in AIMS Gorakhpur, so I have formed a group in which we have around 100 microbiologists from all over the country, and we have teamed them up with people from community medicine. So this is how we have a group where we try to collaborate, because writing a project only from Gorakhpur is not going to give that kind of data or that kind of appeal to people to fund us or to think about accepting our proposal, be it ICMR or DST. So I think multi-centric projects can only help because they give you data from various regions. For example, if I combine AIMS Guwahati with AIMS Jammu or AIMS Madurai, I take up institutions like JIPMER, CMC. So you have to move beyond your institution. You have to move beyond your comfort. You have to bring people who are better than you in your team so that you learn from them. And sometimes they are more experienced than you, and they will be able to guide you. So cross institutional barriers need to be broken. And because when you have people from various regions and you have centers from various zones, you will get definitely good data which will be unbiased, and you will have more sample size. You will have more kind of varieties, and that will also help you in collaborating, because then you will know more people. They will help you. You might help them. So this is basically in which you need to bridge these gaps, and you need to work together and not be secluded or isolated in your own den. But I am doing this. I am the greatest greatest expert that I can be. There are a lot of better people than you, and there's no harm in learning from them.
Yeah. So building on that, in fact, the second question, which is linked to it, like how do you build on the capabilities? Because you said that there is no harm in getting people who are more talented, who are more knowledgeable and more accomplished than you. So how do you balance that thing in a team? Because many times that ego barrier often prevents people to interact freely, get in each other's zone, and actually collaborate and contribute productively. Even if the teams get formed, not much productivity comes out, because many times people just don't get out of their comfort zones, to talk to people and share ideas, because they're always insecure.
Okay, so what's up? Frankly, what I think the answer to this question is that you need to set a goal. You need to have certain kind of incentive. For example, if I am going to collaborate with a person who is more senior to me, I need to know why I am collaborating with him. So I might be collaborating with him because I think I might be gaining something from him. I might gain some kind of experience from him, or he will be of some use to my own research proposal, to my research paper. So until and unless you know the reason behind collaboration, you cannot be just collaborating because you want to collaborate with everyone. You cannot do that. So when 3 years down the line, when I was writing on my own, sir, I was writing probably one paper in 2 to 3 months, and I was thinking that I was doing a great job. So now, since the last 3 years, when I have started collaborating because of people who have encouraged me and who have supported me from all over the world, and they are very, very senior to me. The thing which I have learned is that when you are collaborating with people who are more senior to me, you are always on track. You are not losing out on time. You have that motivation to write better, to publish in good journals, because a lot of things we don't know, that there are certain journals which can be where there is no APC. We always wanted to focus on Indian journals. We will publish in this journal. The Indian journal will take 1 year to publish your article. But if you collaborate with people who are better than you and who have more vast experience than you in your own field, you will always learn from them. And to keep them together is a difficult thing. But people who want to stay together, they stay together. There is no point of keeping people who want to just write one paper or who want some kind of authorship. I think the most important thing is trust. You need to have trust among your team members, that even if you wrote one paper and you are not in that paper as an author, you have so many papers down the line that you will be tired of getting your own name.
Yes.
So trust and team building, that is what we have learned. There is no end to write. There is no end to publishing. But I think the friendship and the bond which you develop over years from a person who is in Colombia or who is in Nepal, and that is going to last. The publication thing might end someday, but I think that is what we need to learn.
Definitely, I completely agree with that. In fact, many times all that I notice is many young researchers, I notice every day they are publishing some paper. Literally almost every day they are sharing something on LinkedIn. But I wonder at times, are they actually focusing on the human aspects, like
Yes.
forming friendships, lifelong collaboration, something beyond professional, are they actually looking at those camaraderie, building a bond in which they can share their challenges, all the things that's experiencing? Because many times you just don't need collaborator, you need mentors, you need friends, you need supporters, you need all kinds of people to go ahead as you steer your journey as a researcher, as a professional, as an individual, even in your life, so it's not just about research publication. So I think I completely agree with you on that point. Okay, let's go to the next question. I have a lot of questions, Aru, for you, so please don't mind that I'm taking
no
much
issues,
time.
sir.
Okay, so I'm very, very sure that our participants are learning a lot of great deal of things. So I just want them to go back home with a lot of thoughts and insights, and maybe food for thought to think about their own careers and focus role of local field epidemiology in setting infectious disease research priorities. How can LMIC focused infectious disease research be carried out at a subnational and national level more effectively to inform the global health policy making?
So I think as in this, the answer to this question would be that most of our researchers and most of our research is basically based on a zonal level, that we want to focus on my state, or I want to focus on my institution. I want to just work possibly with a few institutions which are close to me. But to set up national policies, and I think we are very far behind, and we lack hugely in having a national kind of plan towards infectious disease, because every person is working in their own domain. So, and I think that the other reason could be for this is that India actually lacks ID specialists. There are no ID trained physicians in the country. There is so it's basically a mix of people who are working in medicine, who are working in micro. We need to have trained ID physicians like the US, like the UK, where they are only specialized in dealing with ID infectious disease. We are people who are working in lab also, who are working in the field also. So we need, I think, more collaborative approach on a bigger level between ID physicians, microbiologists, and community medicine, because everybody is working in their own zones. There is no kind of togetherness. The community guy is going to the field, he is working on some disease. The guy in the lab is working on some disease. The person sitting in the clinician is seeing the patient. So we need to have a teamwork. Suppose if I am working on dengue, it should be a approach starting from the screening of patients in the community to bringing them to the hospital to be able to diagnose them effectively, and then to have certain preventive measures which can help stop dengue at the rural level. All of these need to be collaborated. What we are doing in India is that we are all decentralized, and I think we need to bring a kind of approach where we can in India I think focus more on quantity rather than quality. We are focusing on 10-20 diseases at the same time, and that is the reason we are not able to control one of them. So, and the biggest example is TB. We wanted to eliminate TB by 2025. So my friends, they say we might not be able to eliminate them till we last. So that is the reality, and I think we need to work on a team-based approach.
They have started with a very ambitious program, Nikshay TV Nikshay. I don't know what's going to happen, because I don't see anything happening right now, honestly, as far as progress in this space. Honestly, like we can always be ambitious and make lots of noise about it, but as long as we are not united and there is not a clear vision on how we are going to achieve it, I think that's not happening.
Yes.
So wonderful response to that. So the next question to you is, please share one compelling case related to infectious diseases that has been neglected so far in LMICs, and how we can address it more effectively using the power of multifunctional collaboration.
So one case means as in one disease?
Yeah.
Okay. So I think in the LMICs, one disease which I could think of, because I am biased towards TB, so I obviously think about TB only. So because why I think about TB, it is there everywhere, and we have people from the Bangladesh, we have people from the Southeast Asian countries, we have people from Nepal, we have people from the Middle East. So TB is a disease which can be of interest to everyone, and the thing which I would want to work, or which I would want to collaborate, or would want to progress upon, is the diagnostics of TB. We probably can work on finding a test which can be a point of care test, which can detect TB on the go. We don't want the patient to come to us and give the sample, and then we take 2 days to tell him whether you have TB or not. Till that time, the patient would have given TB to at least 10 or 20 more people. So if we can devise a devise a test which can help, or which we can detect TB within a minute, that will probably help in preventing the disease. At least we can screen the disease. We don't have to confirm the disease. So this can be a topic which can be raised, or or we can also work on the accessibility of these tests to the rural population, to the people who are there in the villages. And are we only going to treat the people who come to the hospital? A lot of people don't have access to healthcare. A lot of people don't have access to their financial implications. They don't have money to get themselves tested. We are missing out on contacts. Suppose we have a patient of TB, we are not testing their contacts at the right time. We are testing them, but we are testing them after, for example, 1 month or 2 months. There should be a prompt testing for contacts of patients. They so a lot of things which we can work on, and I think the point of care test would be the best way to go, in which we can have a collaborative approach between IITs, people who are working on developing such kits, and they can be validated on people in different countries, and then we can hope that we get one good, affordable, and accessible point of care which can be given to people and which can actually help in decreasing the disease, rather than thinking about huge goals which we have set in our country.
Right, great, thank you, definitely that needs to be done. I completely agree with you as an infectious disease epidemiologist myself. So we go next to the next question. Can you please share a collaboration with an individual or a group that has led to a real world significant public health impact?
Okay. So we have our own groups where we write our own. We first discuss what we want to write upon. So I think the paper in which I had showed in the presentation, where we had written about the prevalence of myocarditis in dengue. So certain these kind of papers are the one which will inform the clinicians that when they're looking at patients of dengue, or say suppose malaria, or say a very common disease, you should not be only focusing on how to treat the patient. You should be also focusing upon rare complications of these infectious disease, and you should have an index of suspicion that if I am seeing 100 cases of dengue, probably 2 or 3 of them might have myocarditis, probably 2 or 3 of them might have pulmonary edema, 2 or 3 of them might have some kind of rare abnormality. So these kind of studies probably will tell you, and will probably will guide the clinicians that they should have certain kind of index of suspicion, and look upon them when they look at such patients.
Okay, great, thank you. So the next question to you is, please mute yourself. Do not be unmuted. We have not permitted that for anyone. Anyone who is on meeting except me and Professor Mahanti, nobody should speak when the meeting is going on. Next, what are the key steps to disseminate science more effectively as multi-country or global collaborators?
So can you please repeat the question?
Just give me a second. I asked the question. Okay, what are the key steps to disseminate science more effectively as multi-country or global collaborators?
Okay, so as in to disseminate what we want, what are we writing? So the first thing which we should focus on is to disseminate the right kind of information. I always have tried to write in journals which are open access. There is no point of writing your finding, or writing your case study, or writing your kind of papers in journals which don't allow open access, because people don't get to read them. Everybody cannot pay $15 or $20 to access an article, and every institution does not have the kind of ally with big journals where they are given open and free access. So the first thing which I want to tell everyone, the young people who are writing, and even the big people who are writing, is to please write your papers in open access so that we have access to everything. And that should be the first step. The second step should be, if you have published something which is really significant, try to disseminate it to every kind of social platform so that people can read your article there. Everybody might not be having a subscription of a journal. Everybody might not be having access to a library. So if you can post it on LinkedIn's or on your Twitter accounts, or post it on WhatsApp groups, what you have published, so that people can read what you have published, and you can send it to your cross-country friends who can publish it in their groups, so that your paper can be read upon, and hopefully it will get some good citations, because ultimately citations is something which is going to encourage you to write more and more. If you are writing 1,000 papers and you have got 10 citations, that means we are going somewhere wrong. We are doing the hard work, but our hard work is not focused and we are not helping the community as such. So you are muted.
Okay, we have to only work on impactful publication. That's the only way. Please,
True,
everyone be muted. I don't know why some people are still speaking and their mics are on. Hazel, could you please ensure? Yeah, you need to be a little bit patient. When a panel goes on, there are questions which needs to be asked, and we have got such an eminent panelist. We need to take the best advantage of this opportunity. Okay, and we started a bit late because obviously none of you joined on time. So the blame goes to you as well. So please be patient with me, okay? Because I'm monitoring everything on all platforms. So don't think I don't know what's happening. So the last three questions to you are, how can emerging researchers in LMICs contribute meaningfully to multi-country research efforts? What possible points should they keep in mind when starting their career?
Okay, so this question should have been addressed to a person who has excelled and who has had a lot of years in the career. So I'm very young at this, sir. So I can answer this question. I can answer the first half of the question because I am just starting my career. So what I have learned from I have learned from my career, and I've done, I think, learned in the I learned it quite fast. Whenever you are working on certain topic, or when you are working on certain subject, there is no point of delaying that kind of publication. So what we try to do is that we want to work upon it and we want to gather some information, collect it, and then at the end what happens is that it just gets collected. You are not able to write on it. So that is one thing which I want to be very clear. If you want to write on something, be quick and be prompt. Don't wait for don't keep waiting. The second thing is that everybody is not perfect from the beginning. So we might end up writing papers which might not get accepted, which might not get published, which might not get published in even PubMed journals. So at least inculcate the habit of writing. That is the one thing which I tell to all of my juniors, that I am writing for my own satisfaction. I am not writing to get some kind of Nobel Prize or some kinds of huge monetary benefits. So I am writing because I like doing this. It gives me that satisfaction. So we might end up writing papers which are not going to get published. It might get published in non-index journals, but we should not be disheartened by that. So the best thing is to start writing and to keep writing. Gradually, as you keep on writing, you will get publications in good places and in good journals, and that will give you the encouragement to keep on writing. The one thing which I was taught by one of my seniors was that at every point of stage as a researcher, you should have one paper which you are writing and the other paper should be in submission. So if you are doing that, I think we are doing it in the right way. We cannot be writing 10 papers at the same time. Focus on one at a time. Write one paper which you're writing and keep the other paper in your submission, so that if it gets rejected, you shift it to some other journal. But every time in your life, two papers should be on the timeline. One which should be on the laptop which you're writing, and the second paper should be in the system which has been uploaded, so that you are on track. And the last thing which I also want to tell is that there should not be a gap. Once you have a gap, that gap is going to be very, very difficult to fill up, because then you get distracted, and it has to be a continuous process. Let it be slow, but let it be continuous.
Definitely. I think I'm getting inspired by listening to you, that I have to work harder, because I think I'm a bit lazy these days. I have to work hard. Okay, next, the last two questions for you. First one, what advice would you offer young researchers building a career in infectious disease research, especially in LMICs?
So there's a lot of scope in this. Two things which I want to tell everyone is that it's very difficult for a person in LMIC to just do research. So the first thing which I want to tell you is, first get a stable job or a stable profession where you are able to work independently or work in an organization, say a teaching college or a teaching hospital, where you have patients, where you have data, where you're able to see cases, and then subsequently you should jump onto research. Research cannot be the first go-to field in our country, because you will not be able to do it. You will not be able to only do that. So I think the first thing should be to find a good profession, settle down onto it, and then you can do as much as research you want to work. And please do collaborate with people who are working in hospitals, especially because they are the ones who are seeing patients. There's one thing to write a paper on monkeypox. You write a paper on monkeypox, and the other thing is to actually see a case of monkeypox and then to write it. That is the thing which is going to give you the experience of a lifetime, because then you will see the patient and you will never forget it. That will give you the encouragement. So it's always better to work in a place where patients are coming, you see them, and you don't choose to decide your topic. The topic comes to you. You know what you will be working on after 2-3 years of doing research. At the initial point, you should be writing on everything which you want to write. Don't be very choosy about things. So as you start and as you go on writing, probably by the end of 3-4 years, you would know whether you want to do a systematic review or a meta-analysis or a original paper. But at the beginning of your career, please just write. Don't be specific on that.
Definitely. So the last very important question, which
Sure.
I hope you will try to answer, because there are lots of young attendees here, and
Yes,
many
sir.
of them may not be aware of these things. Please share a leadership mantra to LMIC scholars so that our vital knowledge and IPR coming from LMICs is capitalized to enhance our research systems and national metrics and rankings.
Okay. So there is no leadership mantra as such, sir. Because I don't see there is a mantra. The 2-3 things which we have to keep in mind is that, first of all, you have to be very, very humble. A leader, you cannot call yourself a leader. The leader has to be, I don't believe in the concept of leader, because once someone becomes the leader, then he has that kind of ego and such sudden kind of fancies, things which come into their mind. Everybody is equal. We need to have someone like a mentor, not possibly a leader. A person who has the maximum experience might not be the most active guy in the group. So it is very difficult to have all the attributes in a person. For example, I might be the most active guy in the group, but I might not have that much amount of time to give to everyone because of your own kind of occupation or your own kind of field of working. So the leader has to be chosen by the group or by the participant. Even if the group doesn't have a leader, everybody can equally participate, can equally contribute, and can equally write a paper. A lot of people have the concept that the corresponding author is the leader. There is no such concept of that. The corresponding author is just someone who has time to check his mails and to respond to the journal. That's it. So he might not be the person who has written the paper. He might not be the person who has given the idea. But rather than a leader, mentor who is able to encourage you, motivate you, and show you the right direction, so that after some time, even if the mentor is not there, you are still going on your path. So I think that should be the way to go. And it is very difficult to find the right leader. You might not be able to find the right leader in your life. So I think a senior guy who might be able to guide you, so I think would be a better term.
Okay, that's fine. But you left the actual question that I left.
Sure.
I actually asked you. I asked that how do we use the vital knowledge and intellectual property right coming from LMICs? Because we are producing a lot of knowledge. We should not underestimate it, literally. Because if you look at, we have lots of Bangladeshi students here and participants. They are producing very regularly. I'm seeing that. Even Indian participants, But how do we use all that vital knowledge and intellectual property right coming from LMICs and capitalize it to enhance our own research systems and national metrics and rankings? Because that is one of the major issues now in literally
sir,
everything.
I think we are doing a lot of research, we are doing a lot of good work, but that is not being reflected in the world as such. possibly because we don't get that kind of support from the government. You see people in the Middle East who get so much of funds to write their papers, so much of funds to publish their papers. We hardly get any funds to publish a paper or to have certain kinds of new proposals being made. So I think institutions like ICMR and people who are giving funds should be more liberal and should be rather choosing it on a wider horizon rather than just giving it to people who they have just given it to priorly. If I am ICMR and I have given you a fund, that does not mean that I give it to you every time. So you should be, and we should be given some kind of incentive and some kind of prize, that if say I have published a paper in Lancet Infectious Disease, so my team should be given some kind of incentive or some kind of platform where I should be encouraged to write more. Otherwise, our countries in Bangladesh and countries like Malaysia or Indonesia or Thailand, we have so much of data, but we are not able to project that on an international level. And I think once we start projecting them with our own finances, people from the Western would read our papers rather than we from India and Bangladesh reading papers from US, where there is hardly any infectious disease. They are just writing papers and collecting the data and collecting the information. As a doctor, the patient is our gold. So if we have the patient and we have the gold, we should be writing papers and we should be giving guidelines to them rather than they giving us guidelines and we trusting them on our population.
Yeah, that's something which always strikes me, like guidelines coming in JAMA, guidelines coming in NEJM, Lancet, always telling us what to do, means they don't even have the variety and diversity of patients that we see on a daily basis, and they don't even get to see many tropical diseases which we have, and that's why they have created all these tropical disease centers, Swiss Tropical Medicine, London School, Liverpool School, then American Tropical Medicine School. So they have got all sorts of schools. And my point is always that you are coming here, you find our context very exotic. You come to collect data and you literally abuse, you exploit our settings, our patients, our population, our resources and facilities. But what do you give back in return? And that is one of the biggest challenges as well as one of the discourses in the field of global health today. And I am one of the front runners in this discourse. And I always keep asking these questions very critically at all forums, be it Twitter, be it LinkedIn, be it anywhere literally. And one of the reasons why a lot of Western academics actually don't like me for that. Let me be very honest about it. So, and I think we have to work around improving our own metrics, own research systems. And one of the major reasons why this training program is conducted is system strengthening. Strengthening our own systems, research systems, as well as our own health systems. Without investing into capacity building, into human capital development, I think we are going nowhere, first thing. Second thing is resource development and logistics development, which is obviously beyond our own individual capacities, but obviously we'll be able to push and send a bit of nudge in that direction by telling the government and the people in the government, like, okay, there is a huge need, and hopefully there will be some change in due course. And that's something which we are working towards. And in this direction, Global Consortium of Global Health Actors, Leaders and Thinkers is going to work in a huge way across the world over the next few months and years. As this starts building and expanding. We have more than 1,000 members right now, and they come from literally all top universities, all top institutions, and we are growing very, very fast on a daily basis. So I look forward to having lots of very impactful conversation as we start growing and expanding. Over the next 10 weeks, over the next 8 weeks, we'll have speakers coming from Oxford, Harvard, UCSF, African CDC, and WHO, and United Nations. So we have people coming from top institutions in Australia, Malaysia, India, Bangladesh, Singapore, and other places. So we have lots of top people coming on board. They are going to give the very best of the knowledge and insights, all coming from practical fields. So I'm very hopeful and very expectant that our participants will take the best advantage of it and will not leave it. So thank you, Professor Arup Mahanti, for giving your valuable time and for doing the honor of coming on board and telling and teaching our participants about all these very important things which they really need to learn, because at the end of the day, what we can do, and I always believe this very sincerely, is that all that we have is time, and all that we have are some experiences, all the things that we have learned in our lifetime. And if we can deliver that and disseminate and spread it around to our younger generation, I think we are doing a huge service. So that's something which I have been trying. In fact, this whole advanced certificate program is all about that. This is a completely free, altruistic, cooperative created by our collective. But that doesn't mean anybody should take it for granted. So we are going to be extremely strict moving forward. Since you are one of the tutors, so I'm just taking privilege of just spending 1 minute to tell people on what I'm expecting. I wouldn't have told had you been an external resource person. The thing is, see, you need to be very, very serious about attending these lectures, these panels, because we are spending a lot of our time just to connect with people, request them to come on board. You know, it is so difficult. You have no idea how difficult it is to request people to come on board and spend 2 hours of their time talking to us. You know, because nobody really in today's world wants to spend 2 hours talking to people for free. You know,
Yes,
and the kind of experts we are going to get in the future, and the kind of experts who have come already so far in the past 2 weeks, they are brilliant experts. You know, if they spend this much time, they'll earn a lot of money, or they can literally do Netflix and chill at home or spend quality time at home. Why should they come and speak to you unless you are showing that level of genuine interest and participation? So this is my sincere request, that all the group leaders will make it ensured from moving forward that all your team members are on board. We have 300 seats on Teams, and we could not see even full. It had gone up to 170. I had seen. Okay, at one point of time. And there are some people attending live on YouTube, who I have already seen. So, and they are coming and dropping. So that let's say maximum 250 people are attending right now. So that is very disappointing for me as an organizer, as a program director. I was expecting that more people will attend. But obviously, it is asynchronous. People will be able to watch it, and we expect that also, because people across time zones are here. So we don't want to be very serious about taking all these things, but attendance is going to be rigorously monitored. So we cannot help you with that. So if you don't attend 7 out of 9 sessions, we will not be able to give you an advanced certificate program, as simple as that. And if you don't complete your research modules, which means publishing one individual paper, submitting one individual paper, plus one group paper, then you are not qualified. So even if I have to give 10 certificates to people, I'll be very happy. Okay, so don't mind me later telling you, because I'll simply not respond to your messages. If you don't become particular, don't become disciplined, don't attend to things, you know, and I think we are literally wasting our valuable time, because if I spend this much time and spend time with a patient, I'll be earning 5,000 rupees per hour. First thing. Second thing, that if I spend this much time on personal project, I'll be earning money, and I'll be getting a lot of benefit personally, rather than what I'll be getting back in terms of real tangible benefits. So I am just being very plain and clear, and I hope the participants take that from this. But not going anywhere like that. Just to tell you that today evening we had 2 wonderful panels. Professor Betty Selvan Subramanian from Sunway University, Malaysia, an eminent researcher in biomedical sciences, spoke to us about so many interesting things about how to conduct biomedical research collaboration. And Professor Dr. Arup Mahanti from Associate Professor AIIMS Gorakhpur came and spoke to us about real world collaboration and his own experiences in infectious disease research. I think it was both of them were wonderful talks. I have learned so many things, and I'm very, very sure that all of you have learned so many things as well. So I open the floor for anybody who wants to ask any 1 or 2 questions to Dr. Mahanti, and I would request Dr. Mahanti to stay on board. If anybody wants to ask questions, please raise your hand. We'll enable people. Okay, we'll only take 2 to 3 questions, not more than that. So please don't expect that we'll be like letting you ask so many questions. Okay, Dr. Surya, please.
Okay, thank you. Am I audible now?
Yes.
Okay, thank you, Professor Aro, for your excellent presentation for all, especially for the young career, early career researchers. And I'm glad you have presented your published paper with Ranjit. Okay, so we are struggling together to work for many other paper and behind the curtain work. Okay. Now, unfortunately, he left Nepal, so this is the problem of LMIC. Hopefully, you will help us to grow our country. And only my basic, one of the basic question for you is excellent presentations, and we learned a lot. Professor Maheswar, he already told that this is one of the learning opportunity for all of us. My only one question for you is that, so how you in your first slide you started with evidence pyramid, okay? So how will you manage your work pyramid? How to manage your work pyramid? Like how to balance your clinical work, academics, personal, professional life, as well as the research. So what should be the research in your professional pyramid? This is my question. And how to manage?
So thank you for the for the very excellent question which you have asked. So I don't have an answer to this. I have not been able to manage my personal and my professional. Both my timelines are right now working together. So, but what I can tell you from my own experience is that both the things are very important. The personal, if you don't have a personal good personal life, then there's no point of working professionally in terms of be it research or be it patient care. So research is important, but it is not the only thing which we need to do. And being doctors and being physicians, our first objective is to treat patients and to diagnose them. If we can do that carefully and do that well, then only we will have a good data. Because people who are only working on data and who are only working on research will not be doing justice to their patients. And I think patient care should be the priority, and patient care should be followed up with good data, and trying to publish that good data on a good horizon needs good collaboration. So that is what I think you must have seen when I came into contact with Ranjit sir, and that is how he helped me in showcasing our good data on a international background, because we were only focusing on national journals of India and who were taking a lot of time. So both the things need to be balanced, personal life as well as professional work, and this will only come with time, that we will be able to balance both of them together.
So only one compliment from my side. So being a professor of community medicine from Nepal, so you highlighted a lot about community medicine. At least you people are working with them. So yes, I feel myself proud to be a community medicine physician and the experts of this field. Thank you very much.
Sir. Thank you, sir. Thank you, sir.
Okay, Dr. Surya, you are part of a global consortium. Okay, lots of research projects will happen collaboratively from moving forward, and you will be part of that. So nothing to worry. It's just the beginning. Okay. So, okay, next, Samima.
Hello, sir. Am I audible?
Yes.
Thank you, sir. Thank you. First of all, I would really like to thank Dr. Arup, sir. It was really a wonderful session, and I have learned a lot of things from this session. So thank you so much. And my question is to you, sir. I am a third-year undergrad student, and my basically core is population sciences, and I want to shift in epidemiology. Like I want to do my PhD in epidemiology. So how can I prepare myself from now on? I am learning the basics from doing courses and all, and I want to learn the analysis part and all. So how can I start my journey for that? That's my question, sir.
Okay, so thank you for the question. I might not be the right person for this, because I am not a statistical guy. As I had told in my last slide, I am basically a person who works in the labs and who tries to diagnose the right disease to the right patient, to the right clinician. Infectious disease is my core area, and epidemiology is something which I work and which I collaborate with people. So probably this question will have to be addressed to a guy who is in infection, who is an epidemiologist by profession, and how will you go about it? I think probably will be addressed by them only.
Okay, Samima.
Yes, sir.
Your question is very valid, and I'm an epidemiologist on board, so don't worry. Okay, we have lots of experts, including me. If nothing gets solved by anybody, then you have me. Okay.
So obviously I will come to you, sir. Obviously.
Okay, so don't worry. We have a lot of things to discuss over the next 8 weeks. So stay on board, keep learning, keep remaining high spirited. Okay. Okay.
Yes, sir.
Next,
Definitely, sir. Thank you, sir.
next, Mridul.
Yes, sir. Am I audible?
Yes, brother.
Yes, sir. Firstly, I am very much like feeling very happy after this session. It's an amazing session, one of the best session I have attended till now. And I was following Professor Mohanty from long time back, and I have read one paper in December related to antimicrobial resistance, and I have tested for the full paper also. But I think sir was busy and didn't got reply for that. So just I want to ask you, sir, you are currently working as a clinical problem and diagnosis. So what is your perspective? Like I am currently working in formulation development. Hello.
Yeah, I didn't get the last part of the question.
Sir, I'm just asking that I am working in the formulation development for a disease. Like how difficult it is for us to make, like what's the condition of our country? So we are working on a formulation development, and how many diseases are there? The correct formulation is not there to prevent that.
Okay, so what
related to infection?
See, it is not that we don't have formulations for infectious disease. A lot of formulations are not there for a lot of diseases as such. So because the diseases are one side, the drugs are on the other side. This is a general problem. There is nothing specific to infectious disease. The reason behind this is that the drug companies and the disease experts are on two different sides of the table. Whenever you have a disease, the drug needs to be made in concordance with that particular disease. But in India, you have one disease and you have got 1,000 drugs. The patient also does not know what formulation to take. That is why you have agencies like the CDSCO, the Central Drug Controller Organization, who tries to mandate that only certain formulations need to be prepared. And I think they're doing a wonderful job right now in which they're trying to at least make sure that all the unwanted and all the fake drugs are out of the market. They want the clinicians to write generic names, and the formulation should be the same. The companies might change in their name, but the consistency and the composition of the drug needs to be maintained so that it doesn't differ from one patient to the patient. So it cannot be infectious disease only. It has to be the same for every disease, for every clinical condition.
Definitely. Okay. I hope, Mridul, your question was answered. Okay. It's a very tricky question. There is a lot of challenges ahead. So please be prepared to deal with it as a pharmaceutical researcher. Okay. So
yes,
next, Martin Jang Pam. Martin, are you able to hear us? If you want
yes, am I audible, please?
Yes.
Yes, you are.
Go ahead.
Okay, so Dr. Arop, we are very grateful for your presentation. That was a very loaded and very concise presentation. Mine is not the question, but I'm also very interested in infectious diseases. I have a background in microbiology, and I have a master's in disease epidemiology and disease control. Yes, so I want to actually commend your presentation, because not just have you talked about the infectious diseases with your interest in Mpox, which is also one of the key diseases that we have some outbreaks on the last year in my country, Nigeria. But I want to just say that I've been able to get a lot of good insights on the publication aspects, given that you are an editor and some of us, we are trying to get across passing the Q3 or the Q2 to the Q1 publications where we can get good works. So thank you for that very work. And I think the people that are still schooling have a good privilege of having to understand a lot of things from your presentation, so that they'll be able to know how they can put in their papers because I also am a peer reviewer to, I think, some like 7 journals too. So I think that's very good. And that information is very key for them. Thank you so much.
Thank you so much. Thank you so much for your kind words. Thank you.
Okay, no questions, I think. So, okay, then Dr. Malati, please be quick, because all of us have to end this meeting. It's been 3 hours for me now.
Good evening, sir, and thanks for the wonderful session. It's very great. I don't want to spend much time on explaining about the presentation. I just want to have one clarification from Sir Anup sir. Your session is very great and useful for me. One of my patient I met in my OPD. While I'm working in Government Siddha Medical College, Chennai, Arambakam, sir. One of my patient with 50 years of age brought by her son and daughter. They were about to finish their college, and one of her son was also working in after graduation. She was just 25 kgs in her total weight, having few bones with covered with the skin. She is having the past history of the tuberculosis. I refer to her nearby thoracic center at Chetpat Government Thoracic Center. And before that, I am able to get one X-ray from her. That X-ray shows a tubular heart and collapse of her left upper lobe. I don't have any possibility to confirm whether the tuberculosis is active now or something else. What are the tests may I refer for further investigation like that? I want to have such informations.
Okay. So where is the patient right now? Is the patient with you or has the patient been referred?
I just refer them to go for the Government Thoracic Center, working at Institute of Thoracic Medicine, especially working for tuberculosis. If they were unable to find any sputum positive or X-ray findings favoring to the currently available viable AFB or some other test, that's
so what you can do is, because as you can see, the X-rays in the there's a lesion in the right apical lobe. The best test where you can send this patient would be a CBNAT. Just do a CBNAT. You can do a cartridge-based nucleic amplification test, or you can do a gene expert from the patient's sputum sample. And if that gene expert test comes positive, the patient will be positive for TB, and then you can start the regimen.
I hope that question answers your question, Dr. Malati. If anybody else wants to ask question, we have just one
Yes, sir.
spot.
Thank you, sir.
Thank you.
Yeah, after that, we'll not let anybody else ask questions because we'll have to close the meeting now after a few minutes. Okay, nobody else wants to ask question. Great. Thank you so much, Dr. Mahanti, for taking out all the time and for being with us and for hosting this talk and the panel discussion. It was wonderful to host you as a moderator and also as the program director of Advanced Certificate Program. So I hope our participants learned a great deal. They enjoyed listening, and that is very clear in the kind of reactions coming and also from the feedback given in the chat, as well as from the participants who spoke to you just now. Okay, so now I would hand over the mic to Faisal to do the dues. Thank you.
Thank you, sir. Thank you, sir.
Okay. Thank you, everyone. It was wonderful. So please stay active in your groups. Okay, Hazel, could you please stay on board? Group leaders, we will talk to you very soon in your groups. Okay, and Hazel, please stay on board, and Dr. Mahanti may leave because he may have other things to do.